Good morning. I'm Joel Afric, the President and CEO of Respiratory Health Association in Chicago. I want to welcome all of you to this year's annual Living Better Together conference for people living with COPD, their families, their caregivers, and their providers. Today is World COPD Day, and appropriately, November is also National Caregivers Month. Before we get started, a couple of housekeeping things. We'd like to let you know that today's event is being recorded, and we will share the recording link with everyone in attendance. And because this is a webinar, your camera and microphones are disabled. So if you have a question or comment, please use the chat box or the Q&A box if you have any questions or comments. I'm delighted to welcome you to today's conference here at Respiratory Health Association, which we sometimes abbreviate as RHA. Our mission is to prevent lung disease, promote clean air, and help people live better through education, research, and policy change. We've been a public health leader since 1906, when our primary disease focus was tuberculosis. Today, Respiratory Health Association addresses asthma, COPD, lung cancer, COVID-19, tobacco control, and air quality initiatives, among others. Living Better Together, which we sometimes abbreviate as LBT, has been our foundation for providing resources and education to people living with COPD, their caregivers, and providers. LBT is one of the ways in which we seek to empower people living with respiratory illness. We believe that empowerment leads to better treatment and better life, better care, and all-around improvements for people living with chronic lung disease. I can think nothing that better demonstrates our commitment to that empowerment than today's Living Better Together conference. I'd like to take a minute and introduce our COPD team at RHA and today's moderators. On your screen, you see an image of Cherna Halperin and Rachel Morkunas and Kelly Nichols, who will be sharing information about how you too can become a lung health hero. For safety reasons, today's Living Better Together conference is only a digital conference, but we look forward as we enter the post-pandemic world to resuming this as an in-person educational conference, and we hope to bring this back live and in person next year. Whether you've been with us several times or this is your first time, I want to thank you for joining us for Living Better Together. Today, and it's a benefit of being digital, I can welcome attendees from all over the United States and abroad. We have people from 20 different states with us here today, from New York to California, from Michigan to Florida, and we even have some folks joining us from England. I'd also like to give a special shout out to some pulmonary rehabilitation groups who are having viewing parties of this event. And those include ones, at least that we know about, at Ascension, Illinois Suburban Lung, Advocate Good Shepherd, Northwest Community Hospital, Edward Elmhurst, and Northwestern Palos Hospital. Thank you all for joining us. And while we're all joining from different places and we're in different places along the COPD journey, we're all connected by our common commitment to living better with COPD. Today, you are in for a treat. We have 4 outstanding speakers for today's event. You're going to hear from Dr. Nadia Hansel from Johns Hopkins University, who will be presenting on poor air quality and its connection for people living with COPD. April Manassian from University of California at San Diego will be presenting on a very important topic of Stress and COPD, and Doctors Lori Wilkin and Stephanie Lebetz from University of Illinois Health here in Chicago will be presenting on COPD medications and recent surgical options. Today's program, as we've told you, is absolutely free, and that is possible through the generous financial support from our presenting sponsors, AstraZeneca and Verona Pharma. That's why we're able to offer this conference for free, and we very much thank our sponsors. Before we call up our first speaker today, I'd like to bring you up to speed on some of RHA's COPD activities. Over the past few years, RHA's COPD team has been hard at work advancing lung health initiatives and developing educational resources. One of the most exciting is that in 2018, we led a study of the COPD caregiver toolkit that we developed, and we wanted to see how COPD patients, and especially the caregivers, reacted to it. That study was funded by the National Heart, Lung, Blood Institute's Learn More, Breathe Better program. And since its development, the toolkit has been an important resource, and it's been very well received by the COPD community. Recently, the National Heart, Lung, Blood Institute and Learn More, Breathe Better had an opportunity to create a digital version of RHA's toolkit, which made it available online, completely free and accessible to everyone who needs it. And in just the last 18 months, we've reached over 17,000 people with this free resource. We'll say more about the toolkit later. Additionally, we are excited to share that in 2023, our partners at NHLBI's Learn More, Breathe Better program transformed the toolkit into an animated video series to further its accessibility to families touched by COPD. A portion of this event is dedicated to the toolkit and our selfless caregivers. Since today is National Caregivers Appreciation Day, we'll spend some time highlighting our amazing caregivers. Please join us at 11 a.m. Central Standard Time for Caregivers Appreciation, where we'll be talking a little bit about the toolkit in more detail, and we'll be highlighting the importance of supporting our caregivers. Thank you so much to our caregivers. Separate and apart from the toolkit, RHA has also been active in raising COPD awareness among women who are often misdiagnosed or diagnosed in later stages of COPD. This year, RHA launched our Women Empowered Through COPD Awareness and Respiratory Health Education. If that's a mouthful, we call it We Care. That's our We Care campaign, also conducted with support from the Learn More, Breathe Better program. This is a public awareness campaign to educate women on identifying COPD signs and symptoms, offering them assistance where requested regarding tobacco cessation, and also available treatments. The program also delivered educational resources to healthcare professionals regarding the best practices for women who are showing signs and symptoms of COPD. The program resources that we developed were displayed in provider offices nationwide, and our online resources have reached over 200,000 people. All of RHA's available COPD resources can be found on our website, www.resphealth.org/COPD, and they will be shared with you after today's event. Thank you all for joining us. We hope you enjoy your time learning with us, and you walk away from today's conference thinking of one or two ways that you can improve the treatment of COPD and caregiver health. And with that, I would like to introduce my colleague, Kelly Nichols, our Senior Manager of Program of Policy and Advocacy, to talk a little bit with you about how you can get involved in some of RHA's COPD advocacy efforts. Thank you again. Kelly?
Thank you, Joel. I appreciate it. It's always nice sitting here and hearing all the great stuff the organization that you work for does. And it's so exciting to see everybody here today wanting to get more information about COPD and understand more about what is happening at RHA. I'm here to talk about my favorite subject in the world, which is advocacy. And I want to let you know that one of the things that I love about advocacy in every spectrum, not just the political advocacy and the health advocacy that RHA does, is that it means that you're able to speak for yourself and create the change that you want to create in your world. So I'm going to talk a little bit about what we're going to do, what we do at RHA, and how you can become involved in some of the work that we're doing. So the first thing I wanted to tell you, everybody, was that RHA as an organization and our advocates work really hard together to change policies with legislators at the state and federal level, with municipal decision makers like city council people and mayors and Cook County board members and other counties board members. And when we get outreach from other places in the US, we often engage with policy or sign on to letters that originate from other parts of the country that are trying to do the work that we also support. And also corporations. There's a lot of advocacy, especially for COPD patients, around drug availability, and that has to do with corporations. And our environmental health department works with understanding the impacts of corporate polluters and things that have to do with the businesses that are in place that impact the kind of world that we have and the kind of air that we breathe and healthcare that we're able to access and medications that we're able to access. So we do all that kind of stuff. And it's really important to help create change. So usually sort of this time of year, we plan for the next legislative session here in Illinois, which starts in January. And we work with other associations and membership-based organizations around the country to understand what the priorities are for our advocacy work and where we can engage. We strategize our goals and put policies in place, and we make sure that everything that we support really has a lot to do with protecting lung health, protecting access to lung health, the things that support lung health, and to keeping the air clean. When we do our strategic planning, and one of the biggest parts of advocacy is that we determine who can help us achieve our goal, like who is the change maker that is making the decision about the policy that we're trying to pass, how we can get that target to take action. That's a cool little thing that I'm not going to go into in great detail today, but it's called power mapping. Who is that change maker listening to that we can talk to that would help that action happen, right? So if somebody listens to a certain organization, then we figure out how to access that space to influence that decision maker. And then also, most importantly, and my children would tell you this, what are the obstacles to the achievement of our goal? In this framework, it's the obstacles that are to our achievement of a policy goal. But basically, is there a competing piece of legislation that's going to make it difficult for us to, like we helped last year, add e-cigarettes to the smoke-free law? Is there something, a faction like the tobacco lobby that's pushing against legislation or ordinances that we want to help elevate and pass? Or really, is there just an obstacle of time? Is time running out in the legislative session? Is the federal government facing a shutdown and we can't get things over the finish line in time? So we consider all of that as we're planning our advocacy work. And that's all the really high level stuff that we do. But the most important part is where I want to talk about next. And that's how you can enter that picture. So basically, we do all that planning and strategy, and then we figure out how can our advocates help with what we do, right? And oftentimes we go through the lists of people who have identified that they'd like to help with RHA, but also we reach out to people who we know are concerned about an issue, like patients who have COPD. And we ask them to do something like email or call or, even write a physical letter to legislators or elected officials to tell them how important that piece of legislation is to you. And one of the things I want to say about that is that can sound really scary for someone who doesn't live and breathe policy like our team at RHA that works on this stuff every day. And so one of the things that I really want to make sure that you understand today and that I love is really helping you understand what the policy is asking, how you can talk to an elected official, how you can engage with that person and connect with them in a way that helps them understand what your concern is about the legislation or how you support the legislation. So it's not a sort of blind ask. It's not a, here's an email address, send this email, send an email to this person. I love the part of my job that makes me able to walk through this journey with you because of all the experience that our team has to be able to guide you in a way that gets the point across and helps us move this policy. We always, if that even feels too intense, we always have action alerts. Usually they're linked at our webpage, which is here on the slide, which is www.resphealth.org/advocacy. Our website is shifting and changing from time to time. So if you ever, and you'll see on the last slide, my information, if you ever don't see something there that comes up for you that you have a question about, you can always reach out to me. Sometimes we ask for people to visit elected officials' offices with us, never alone unless you really want to, but often with me or with one of the other policy experts at RHA to actually talk in person to someone about a policy that matters to you. And also we work together to write letters to the editor that get published in the paper, or we ask people to do interviews if that is something that they're really passionate about and that they love to do. I've always said, I find something that I'm good at and I really go all in. Like, as you can probably tell, I really love to be a public speaker. So I'll always go visit somebody in person. I'll always go stand up and speak at a press conference. But if your comfort zone is writing a letter or signing an action alert, that's okay. Any advocacy, even the support of an advocate is exceptional and helps us get these policies passed. So the next thing I think we wanted to talk about is some important things to remember when you visit an elected official or when you're talking or framing messaging to an elected official, right? These elected officials represent you, right? Any elected official or person in power is a human being, just like you. They go home to their lives after work every day and they interact with the things that they deal with on a day-to-day basis, just like we do. But also at their jobs, they represent you, they work for you, and they need to listen to what you have to say. And a huge part of that, and a huge part of advocacy generally, is something that is important for all of us in day-to-day life too, is that's accountability. Just like you would with your medical professional who's helping to treat your healthcare issues, accountability is critical. The example that I put in the slide is, can you even imagine any of us being hired for a job or hiring a person for a job and then saying to them, good luck, do your best, we'll see you in 2 to 4 years when you're up for election again? Of course not. That would never, ever happen. I check in with my supervisors, other people check in with the people that they're accountable to, and you're never just given free rein because you have a title to accomplish what you need to do over the 2 to 4 year span that many elected officials have in office. So part of what we do as advocates is we really remind people where they said that they were going to help represent us in that space. So a big part of what we need is you, right? The policy needs for the COPD community is, we know that they're very well known, right? There's unavailability of liquid oxygen for those who need it. There's coverage for virtual pulmonary rehab and cardiac rehab. There's the high cost of the much needed medications, research dollars to fund a disease progress that is literally the 3rd leading cause of global death. Did you know that hundreds of pieces of legislation pass through an elected official's office constantly, like hundreds? Everything from where a dog park should be to how to pay for a new road to policy on oxygen supply. And all of those issues are important to the people who care about them. And legislators often remember an important issue because of the people who show up to talk about that issue. People like me who work with advocates know that if I can get a person who is touched by an issue to talk about why something is important to them, to an elected official or decision maker, I can get that elected official to really see the issue, like see the need for liquid oxygen and not just a piece of paper with words on it that is written policy. They need to see the things that they vote on and how they affect real live people who are trying to survive with an incredibly complicated, underfunded, under-researched, and misunderstood chronic health condition. Until you tell them, they don't really get it. Like, they might not know that your daughter quit her job to spend all day calling around to pharmacies looking for a medication. They might not know that you cannot leave the house often because you have a limited supply of critical oxygen and have to make choices about when and how to use it. They might not know that you and your spouse were up all night trying to figure out how to pay for pulmonary rehab, expensive medications, and a caregiver on your combined Social Security checks. But once they know about you, they have to act. Your story I say this all the time, and I hope that you can hear me when I say this. Your story is so important. And I know all of us we say, oh, well, my story is not important. I don't do much. I have a pretty low key life. Your life is incredibly important, and they need to know that. A legislator or a decision maker needs to know that. You deserve every day to have safety, care, and an investment in your health and future. If you take the time to tell your story today, RHA can reach elected officials and change lives, like your life and your family's lives. Please let us know what your story is. I know a lot of times it doesn't feel like it's enough, but more than anything, legislators tell me about how a person, like just one person meeting with them, changed their minds about something that was just an idea on paper. So we have created a survey to be able to hear from you. You can also email me at the information that's on the slide. You can also email any of the contact information and the contact people that you have working with you on LBT today, and they will get the information to me. But we did create a survey. Cherno just put the link in the chat to be able to hear from you. And the link to that survey will be right there and will also be sent out in the conference recap email post-event. And that survey has 5 prompts. What I wish people knew about COPD, what does a good day with COPD feel like, lung health matters to me because, and what does a COPD conference mean to you, and how has pulmonary rehab helped you? I just would love for you to answer the prompt that feels most appropriate to you with 2 or 3 sentences. And I'll be in touch if I have more questions. But honestly, those 2 or 3 sentences are often enough to really change someone's mind. We're going to use your comments to support the advocacy efforts in general and raise awareness about what it means to live with COPD. So our hope today as a team at RHA is that you will gain knowledge and skills that will help you live well with COPD. So I hope that you will take that time to either now or at another point, fill out that Google form, put your information in. If there's a prompt that doesn't speak to you and you want to put the information in, just drop it in whatever field you want and I'll figure it out. Pretty smart cookie when it comes to that. So feel free to write whatever connects you to this issue that you want to share. But what I really appreciate most is seeing all of you here at this conference, knowing how much you're learning about COPD and being able to talk to you about one of my favorite things in the whole wide world, which is advocacy and how to stand up for the world that you want. So thank you to Rachel and Joel and Cherna and everybody at RHA and everybody working on COPD for giving me this time today. I really appreciate it. Rachel? Or Cherna, I'm not sure who's coming next.
Yeah, thank you, Kelly. That was great. We would now like to introduce our first speaker, Dr. Nadia Hansel, who will be presenting on poor air quality and COPD. Dr. Hansel is the interim director of the Department of Medicine in the Johns Hopkins University School of Medicine and the interim physician-in-chief of the Johns Hopkins Hospital. Dr. Hansel's areas of clinical expertise include chronic obstructive pulmonary disease and asthma. Her research focuses on understanding environmental determinants and subphenotypes of obstructive airway diseases. Dr. Hansel was also the 2021 recipient of Respiratory Health Association's Salovey Award for Advancement in COPD. If you have any questions for Dr. Hansel during her presentation, please type them in the question and answer box and they will be answered during the question and answer portion at the end of her presentation. Now, I'd like everyone to please help me in welcoming Dr. Hansel. Dr. Hansel, you should now be able to share your screen.
Okay, thank you for that kind introduction. If you'd give me 1 second, I am going to work on sharing my screen. Can you please confirm you're seeing it correctly?
Yes, we can see it. Thank you.
Awesome. All right. Well, I'm going to talk about air quality today and loved following up on that energetic talk on advocacy because I think that's very, very important. I'm going to talk a little bit about beyond cigarettes, what else to watch for with the focus particularly on air quality. Let me see if I can, not much disclosure. We will be talking about some air cleaners, and those were donated for a study that we were doing. But when we talk about air quality, I don't want to ignore the fact that smoking really is the leading cause of COPD in the United States. That being said, a lot of what my future slides are going to talk about is really the fact that there are a lot of concerns or environmental issues that I think also contribute to disease or making people with COPD feel worse. And really, on the left of this slide are 4 points that I think really make us think that there are issues such as air quality beyond smoking cigarettes that can make people feel worse who have COPD. The first is that 15 to 20% of smokers develop COPD. And so a large majority of people who smoked actually never develop airway obstruction, which is great. But that does definitely tell us that there are other contributing factors. Genetics and an individual's susceptibility to cigarette smoke or air pollution exposure is definitely thought to be one of those contributing factors. But again, that doesn't explain all the risk. 1 out of 4 Americans with COPD actually never smoked. Again, that tells us that there are other factors in our environments that are probably contributing. And when we look at studies across the US, only 15% in the variability of our lung function is actually explained by what people report as smoking. And I do think that smoking explains more than 15% of our variability in lung function, but it's very hard to measure. Like we ask people, how old were you when you started smoking? How old when you quit smoking? And on average, how much did you smoke over that period? And we know that there's a lot more nuances to that. People start, they quit, they inhale, they don't inhale. And so really, I do think smoking explains more than 15% of COPD. But again, there are other factors. Part of that is that people obtain different lung function in adulthood. So what are exposures that people may have as children that might predispose one to the development of COPD? And how quickly someone loses lung function, again, is explained by smoking, but also other factors. So the COPD Gold guidelines, which are sort of our national guidelines, actually created a new category of COPD that's called environmental COPD, which is really thought to be smoking, but also vaping, e-cigarette use, but exposure to household air pollution, ambient air pollution, wildfire smoke, and occupational hazards, also very important. Here's a picture on the right of biomass use in developing countries. But what I would like to point out is that you can see that these 2 people are sitting in a very high smoke environment. There are also much healthier environments in the US that also, when someone is sitting in that smoky environment, probably contributes to air pollution and to respiratory disease. Occupational exposures, if someone works in a dusty area, as an example, 20% of cases of COPD are thought to actually be due to workplace exposure. And when we asked about 2,000 people with COPD across the country whether they worked in a dusty job, we saw that there was actually a 44% higher risk of developing COPD, even if they actually or despite their active smoking. So again, the dusty environment with which one works also contributes to how to the likelihood of developing COPD, but also the likelihood of having symptoms. So this is just some symptom measures, like how much are you coughing? How much are you short of breath? How is your life affected by your limitations in your breathing? And these are people who have smoked for at least 20 years, and they found that if you also worked in a job that exposed you to vapors, dusts, gases, or fumes, that you had more respiratory symptoms and more emphysema on your CT scan, and were more likely to need to go to the hospital because of difficulty breathing. Secondhand smoke. There's a lot of data that suggests that if you live with a smoker or have secondhand smoke exposure, that you have a higher risk of COPD. But really, even if you have established COPD, Living with a smoker or having smoke in your environment can also lead to having worse shortness of breath and higher risk of going to the hospital. That also, even if you are unable to quit smoking yourself, having smoke in that home environment, so having someone smoking inside the house, means that you have worse respiratory quality of life and increased risk of going to the hospital. So encouraging people to smoke outside the home, even if you continue to smoke, is still probably really beneficial, because just being in a home environment where that smoke, if you remember one of the earlier pictures, just that smoke inhalation can probably have added risk to the cigarettes that can be smoked. And again, we definitely think that smoking cessation is the best thing that someone can do for themselves if they're still smoking. But even if they're unable to quit smoking, there's likely some benefit from making sure that the smoke is not done inside the home. I do want to pause a little bit on outdoor air quality, because there's a lot of attention that comes to particulate matter exposure. Particulate matter or particles are really just a mixture of particles in the air that are very small. You can't see them by the naked eye, right? So on the left, you see a hair shaft, like a blown up picture of a hair shaft. And you can see these particles of 2.5 micrometers in diameter are really small, much smaller even than a hair shaft, but we breathe them in. I'm going to bring your attention to the photograph on the right. This is the Boston skyline just 4 days apart. The top photo on the right is the Boston skyline on a good air quality day. And the picture at the bottom right is the Boston skyline on an air quality day that's not so good, again, only 4 days apart. So we think about high pollution days that gets a lot of attention in the news, particularly in China or other places where we have particulate matter levels even in the 200 level. In the US, we don't see levels that high, but we do see levels on occasion that hit the 55 to 65 range. And you can see by that bottom right photograph that the visibility on those days is very impaired. So it's not hard to believe that breathing in air when it is more cloudy and dusty can actually have detrimental health effects. And as a matter of fact, it does. So it's been shown that outdoor particles, when they're higher, will lead to accelerated or faster loss of lung function over time, over years. If you have COPD, it's more likely that when there are bursts of days of high pollution, that within the next 1, 2, or even 3 days after a cloudy day, that you're more likely to have to go to the hospital. This has been shown multiple times in multiple studies over the year, and that this effect can actually be delayed again up to 3, maybe even 5 days after the cloudy episode. So it's not just the day of, it could be a delayed effect over a few days that it just sort of triggered an inflammatory response that makes it so that people are more likely to need prednisone or antibiotics or need to go to the hospital. It's also been associated with a higher risk of death and actually just more respiratory symptoms, even if they don't necessarily mean that you need to go to the hospital, but you have more shortness of breath, more nighttime chest tightness, and other more mild symptoms. Before COVID-19, it was kind of hard to tell people what to do. It was try to stay indoors on high pollution days, but now we can tell people masks are much more common, right? If you are able to on a high pollution day and you're going to go outside or you're going to be in an environment where there's worse air quality, to think about wearing those N95 masks that actually can filter the particles. This is just ozone gets much less attention than particulate matter does, but there are also areas that have high ozone, and there's a lot of geographic variability across the US, but there are sort of public websites that can tell you what the ozone is in your area. But we can see here on this graph, again, this is a study that we did across 2,000 patients with COPD in the US, that ozone can also be associated with worse lung function, more likely to be hospitalized, higher odds or likelihood of developing COPD or having worse emphysema, and also having more respiratory symptoms. So outdoor particles and outdoor ozone level both have been shown to be associated with worse symptoms. I do a lot of work on indoor pollution, and I really feel it's important to not just talk about the outdoor air, because as an individual, there's a lot less that you can do about the outdoor air, right? So one thing is to stay inside. Another thing is to wear a mask. But other than that, it's very hard potentially to do anything personally about the outdoor air quality. But there is a lot more that you can do about your indoor air quality. And a lot of us, myself included, spend a lot more time inside than I do outside. So the indoor environment is definitely a place where we have a lot more control about what we do and how we can control the air inside our homes. This is just a picture of a lot of different potential sources of things that contribute to your indoor air quality. We talked about secondhand smoke exposure already and smoking. Does smoking inside your house versus smoking outside your house matter? It does, right? So if there's any smoking activity in your house, if it can be done outside, so it doesn't stay closed up where you breathe that air, that is helpful. But cooking and burning candles and incense, some places in the US do have wood burning stoves. Living on a street and having cars traveling through the street, and if you have open windows that can breathe in. I will say this is two different communities of homes with patients with COPD where we put monitors outside the home and inside the home at the same time. And I don't know if you're familiar with looking at graphs like this, but what I just want to point out and explain is that the indoor air here, higher particulate matter levels are worse, right? If you remember that Boston skyline, levels of just PM levels of just 50, when you have that horizon view, you can see that the air looks a little cloudy. When you're in your house and it's like 10 feet, maybe 20 feet, it's hard to see that cloudiness. But a lot of our homes have PM levels much higher than that 50 that we saw of that Boston skyline. And if you can just look at our indoor versus outdoor comparison, you can see that a lot of the indoor PM levels are actually higher than the outdoor air, right? So our EPA, our Environmental Protection Agency, will tell us on a high PM day or a high ozone day, stay inside. However, what is your inside air quality? That matters. We've done studies that showed that the indoor particulate matter levels are also associated with a higher risk of needing to go to the hospital, more respiratory symptoms, worse quality of life, and higher need for your rescue medication or that albuterol type of medication to help you breathe. So the indoor air matters. Well, there are other things that matter as well. We do think patients with COPD who don't have access to a healthy grocery store actually have worse respiratory symptoms. I think this data is a little bit less clear, but I do want to ask the question, can diet affect our respiratory health? This is a little bit off the topic of air quality, but I just wanted to take the moment to make us aware or think about that there are potentially more things beyond just medication and beyond just smoking cessation, though I will agree that that is one of the most important things, if not the most important thing you can do for yourself to potentially decrease that inflammation response. And there is some suggestion that eating healthier diets might improve our respiratory health. I think we need to learn as a COPD community, we need to do more research in this area so that we can really more specifically guide people as to what kinds of foods might help. But really, it's a lot of factors that come together to impact how well we can accommodate our lung function impairment. And I just want to add that if you take the same person that has 20 years of smoking, who is able to successfully quit smoking, but has exposure in a dusty job, has someone living in the house who also smokes, lives in a neighborhood with high ozone levels or high particulate matter levels, and doesn't live close to a healthy grocery store, has almost a 20% lower lung function compared to that same person with the same 20 years of smoking with none of those other exposures. So we definitely think that trying to improve your health includes not only smoking cessation, but trying to decrease your exposure to other sort of dusty environments. So what can we do? Well, as I mentioned, try to avoid dusty environments. Our gold guidelines, our national guidelines on COPD definitely say with grade A evidence, smoking cessation should be pursued for all patients with COPD. None of this discussion about air quality suggests that that's not the most important thing to do. Effective ventilation for polluting stoves. I think for anyone that has cook stoves that use coal or wood stoves, definitely improved ventilation would be helpful. But also that clinicians should advise patients to avoid those continued exposure to other irritants and air quality measures. We know that improvements in air quality have measurable health benefits on the lungs. Improved air quality improves lung development in children. And if you have better lung development in children, you're going to have more reserve as an adult with your lung function. Reducing exposure to particulate matter lowers lung function loss over time in adults. Improved air quality in California was shown to be linked with less bronchitic symptoms or cough and sputum production. And reduction in air quality or improvement in air quality has been shown to have been to lead to lower mortality or death. What can you do about that indoor environment? Well, we talked about some of the sources that can contribute to pollution or poor air quality in your house. So trying to minimize those things like fireplace burning or candle or incense burning, or at minimum, if you're going to do those activities, try to improve ventilation so that dusty air can go outside. We did a study about portable air cleaners. There are different portable or ways to clear the air through air cleaner strategies. We know that putting portable air cleaners in your house can improve that particulate matter pretty quickly. We did a study to see if that could improve your quality of life or your respiratory symptoms. And it showed that in those people that received these active air cleaners, it did tend to improve their respiratory symptoms. But not everybody used the air cleaner. That makes sense, right? You get an air cleaner, you can turn it on or you don't have to turn it on. But if you turned on that air cleaner at least 80% of the time, or if you turn it on 100% of the time, you can see that dose response improvement in respiratory symptoms. So I do believe that the use of purifying the air or clearing the particles in the air has potential to improve your health. This was done in a small study of 100 people or so in the Baltimore area. So, I think we definitely need to do more studies to see, can we make this recommendation on a broader scale? But for any patients that feel as if their home may have a slightly dustier environment, personally, as a physician, I do recommend this to see if it can be helpful. And if we think about cost, a lot of our medications actually cost more than running portable air cleaners, which really is the cost of the commercial air cleaner itself. and running the air cleaner, which honestly, for most of, if you choose an energy efficient model, is about the cost of running a light bulb. So we need more studies, I will say, as a profession to know, can we, these air cleaner studies on a broader scale, can they help? Can we do a diet intervention trial to say, hey, what type of diet could be most helpful? We have a lot of work to do as providers to be able to guide people more specifically about the things that we can do to reduce these other exposures. But I want to end with this last slide. I really do believe that multiple exposures beyond just cigarette smoking are linked to worse COPD outcomes. Occupational exposures, we want to minimize those as much as possible. Secondhand smoke exposure in the home. Definitely encourage folks to smoke outdoors if they are going to smoke, preferably not, but if they are, outdoors rather than indoors. Your indoor air quality matters because you're in your home, as an example, for the majority of the day. Outdoor air pollution, in particular, ozone, particulate matter. We can check on websites to know what that particulate matter or ozone level is. Avoid being outdoors on those high pollution days could be an option. Wearing masks on those high pollution days might be a better option. But again, going inside needs to be taken into the context that you're going inside to a healthier air environment. And so that's where paying attention to the air quality in your home also has the potential to make a difference. And though it's hard to know specifically and to tell you definitively that nutritional approaches can help, I definitely believe that eating less or eating healthier foods that have less inflammatory potential can help protect us against the environments that might be sort of this pro-inflammatory, right? COPD definitely is an inflammatory disease where the lungs are aggravated, and doing everything we can to keep those lungs as healthy as possible can help us. So we need more evidence-based interventions. A lot of healthcare providers are working on that so we can better continue to guide. But in the meantime, I think there are still sort of common sense suggestions that we have to continue to try to improve our respiratory health. So thank you so much for your attention, and happy to answer questions as they come or how the hosts would like us to address them. But thank you very, very much for your attention.
Thank you so much, Dr. Hansel. We have a couple questions. First one in the chat is, if I use a gas cooktop at home, do you recommend that I turn on a fan every time or every time I turn on a burner?
Yeah, great question. And I didn't talk much about NO2, but there is evidence that gas stoves create not just particles from the cooking, particularly if you burn food, but they actually also create nitrogen dioxide or nitrogen oxide. We also believe that that's an irritant to the lungs. So yes, I would say ventilation outdoors is helpful in that instance. You can also get air purifiers that have carbon filters, and the carbon filters absorb gases, including nitrogen dioxide. So I would say that the three things that you could do to reduce nitrogen dioxide exposure is changing a gas stove for an electric stove, though many people don't want to do that. External ventilation to pull the fumes from the gas stoves out. And the third thing could be air purifiers that actually have carbon filters. Not all commercial filters do, so you have to ask about that. That can also absorb gas.
Thank you. Another question is, what's a specific good air cleaner to use that you may recommend?
Right, so I definitely am not an advocate for one air cleaner versus another. We've done several intervention studies with different commercial air cleaners. They do need to be HEPA grade to be able to clear the particles. But if they're HEPA grade, that should be adequate. Then different air filters have different power in terms of how much they are able to pull air. So you could look at whether they are energy efficient, and you could actually look at how powerful they are to circulate air and what room size that they cover. I will add that to create a larger room size, and a lot of air filters would have different levels. As the level goes up, to use a high power setting is obviously going to be better than a low power setting. But the high power setting may create a little bit more draft and a little bit more noise. And so some of those things are important to take a look at as well. But honestly, I think all HEPA filters should clear the particles. After that, it's really more about how powerful of the unit do you want. And that might depend on the size of your room or how much particles you think you have in the air.
Great. Another one we have is, how about the impact of third-hand smoke, the smoke that lingers in carpeting, drapes, etc., on breathing?
Fabulous, fabulous question, because there is third-hand smoke. I will say we don't know. I think that's another area where more studies are needed. I would say I think it's probably less of a problem than secondhand smoke, because I really do think it's about the air that we breathe into our lungs. So it's probably much less of an issue, but I would say we don't really fully know because those studies are really far and few at this point. But that's a fabulous question.
And then another one is, a friend said sweeping with a broom is bad for people with respiratory issues. Is that true?
So that's another, you guys have really fabulous questions. Brooming will re-elevate particles, right? So if you broom, it elevates particles. And so that definitely is associated with higher air particle levels. So it's probably not the preferred way. Vacuuming would probably be better, because vacuuming does have sort of a vacuum with HEPA grade filter will suck up those particles as opposed to resuspending them. It doesn't create particles, it just resuspends them. So keeping a clean house is very important. If broom is the only thing you have, I would probably broom, because otherwise you're just going to have particles that accumulate. But I do think that is a real concern. Brooming does resuspend particles, and people in houses where brooming is a common method of cleaning, we do see higher particles in the air, which I do think can impact your breathing. So I would recommend sort of vacuuming instead of brooming if that's an option.
Great. Another one that we received was, is there a way to measure how much the smoke from the 2023 Canadian wildfires has damaged the lungs of Illinois residents with COPD?
Yeah, another great question. I have not seen studies on COPD. I have seen asthma studies that have looked, or studies of respiratory symptoms, not necessarily COPD specific, that has shown that not just in Illinois, but also New York, Eastern, like basically in the Northeast US, that from the Canadian wildfires, particulate matter was higher. And in the few days surrounding those higher levels, people had more respiratory symptoms and were more likely to present to the emergency room. So do I think it had acute impact on higher need for acute healthcare visits for people with chronic lung disease? Yes. I can't sort of quantify that specifically for COPD patients, but for patients with chronic respiratory disease, which included asthma and COPD, we did see higher emergency room visits in general. So those wildfires definitely are impacting our lung health.
Thank you. Some more questions we have are, oh, there's one in the chat that says, do insurance companies cover the cost of air filters given their cost effectiveness?
So they don't. And I will say we have not proved cost effectiveness yet. So just have an NIH study that just got funded for us to launch and recruit and randomize 770 COPD patients that have quit smoking into active versus sham air cleaners to prove in a larger setting beyond just Baltimore that we can improve respiratory health and that it's cost effective. My hope is that running such a study will prove cost effectiveness so that we can go to insurances and say, look, this is going to benefit you to pay for air cleaners. Right now, the data proving cost effectiveness is not there, right? Is it cheaper to have an air cleaner than a medication? Yes. But does the air cleaner, is it as effective as the medication? How many hospitalizations could I prevent by having an air cleaner? And what's the cost of the air cleaner to the insurance company? That type of data doesn't exist yet. We just got funded by the National Institute of Health to run that study. So I hope when that study concludes, we'll be able to go to insurance company and lobby for this, because I definitely think the downside is that you could get an insurance company right now to pay for your medication, but you can't get an insurance company to pay for your air cleaner. So there is a higher cost to a patient, but I don't think there's a higher cost to our health system, but I need to prove that first before we could go back to our insurance companies and ask them to cover this.
Great, thank you. Another question we just got is, are you accepting patients to participate in this type of study?
Yeah, well, it's probably going to launch in June. So we're going through all of our IRB protocols. We would love to have interested patients participate.
Thank you. Another one we got was, are flare-ups mostly from pollution, and are flare-ups in COPD from pollution different than other flare-ups?
So many great questions. I would say the most common cause of flare-ups for COPD are viruses. The second most common cause of flare-up is bacteria. The third most common cause of flare-up is non-infectious, where we think it's mostly probably pollution-driven, maybe stress-driven. But does pollution predispose people to viral infections or to worsening viral infections? That's possible too. So it's hard to know. I would not say it's the most common cause, because we do know that viruses are the most common cause. And during COVID, when people were more staying home and wearing masks and avoiding respiratory infections, we saw a drastic drop in hospitalizations for COPD flares. So we definitely know that avoiding viral infections is probably a way to have the greatest impact. But people are going back to life, going back to normal. And so it's hard to avoid viruses. But I would say mask wearing can have a two-time benefit. It can reduce your viral exposure, and it can potentially reduce your particle exposure. So it could be a win-win opportunity to reduce flare-ups.
Great. And another one is, if you work in a dusty environment, other than staying hydrated, is there a supplement or exercise that can reduce or expel phlegm?
So expel phlegm is a tough one. Are there ways to expel phlegm? You're right, staying hydrated. What we recommend as COPD providers are things like flutter valves. If you don't have one, you could ask a provider that tries to help vibrate the air in your chest so that it's easier to expectorate. There are mucolytics such as guaifenesin that is supposed to thin the secretions. That can help people expectorate. There are vests that help to sort of tap on the chest to loosen up the phlegm to help people expectorate also. So if you have chest congestion and phlegm that you're trying to get up because you just don't have the option to improve your environment and that's contributing, I would talk to your provider about some of those other options. If you work in a dusty job, right, is there options for mask wearing? Is there option for having a portable air cleaner in that work environment, right? We don't really have studies in COPD that says if you could have air cleaner in your work environment, does that improve health? But it would be sort of a logical extension of some of the work in the home environments.
Great. One more question is, what type of mask would be the best to wear on a high air pollution day?
Yeah, I would recommend the N95 masks, the same type of masks that we were recommending during COVID-19. And again, as I was just mentioning, right, those type of masks can both reduce your viral exposure as well as particle exposure.
Great. One question in the chat is, how does an interested patient contact you to participate in a study?
Great question, and maybe we could put something in the chat. They're going to be, we'll be launching a study at Hopkins in Baltimore, Iowa, Alabama, Los Angeles. Those are the sites now, so it depends where you live. We're adding additional clinical sites, so we could find you a site that's closest to home.
Great. Yeah, we'll definitely put something in the chat about that. Some other ones are, does running an air conditioning help with filtering outdoor pollution in a living space?
Great question. So central air conditioning can help. You can put filters, right, in your central units, but those filters need to be updated. They need to be changed. But yes, central air cleaning approaches are probably just as effective as sort of the portable air cleaner approaches as well. But again, you need to make sure that those filters are changed and updated. I will say I didn't talk about temperature, but since you mentioned air cleaner units, temperature matters too, right? So the lungs don't really like extreme heat and they don't really like extreme cold, right? They like kind of that 70-degree temperature. And there's a range of temperature, probably 68 to 74-ish type temperature that the lung tends to feel pretty comfortable in. And when you get on the really cold or the really hot, the lungs aren't really happy. And we think that particles are more detrimental in extreme heat situations. So I think an air conditioner or a central air unit is helpful for two reasons. One is you can have them fitted with filters so that they can filter the air. But the other thing is I do think it's important, if possible, to keep your home at sort of a comfortable temperature for the lungs. So I think there are two benefits in that regard.
Great. I'll ask one last question. It says, I use a standalone fan every night to sleep. Is this harmful?
I don't think so. If you're comfortable, I think that's great.
Great. Thank you so much, Dr. Hansel. We appreciate your presentation. Now we will take a bit of a break and come back for our next webinar, a 5-minute break.
Thank you so much.
Thank you so much.
Hi, everyone. Welcome back. We would like to introduce our next speaker, Dr. Arpi Manassian, who will lead a webinar on COPD and stress management. Dr. Manassian is a clinical psychologist and an attending clinician in the UC San Diego Health System. Her clinical area of expertise is consultation liaison, and she oversees psychological services at the Burn Center, the Pulmonary Rehabilitation Program, and others. Dr. Manassian has a research program that is focused upon understanding the relationship between biology and behavior in mental illness, medical illness, and substance abuse. Again, please utilize the question and answer box to submit any questions you may have. Please join us in welcoming Dr. Manassian. I'm going to stop sharing my screen.
Hi, good morning, everybody. Hopefully you can hear me okay. Let me just share my screen real quick. All right, hopefully folks can see my
Yep, we can hear you and see your slides.
Perfect. Awesome. All right. Very good. Thanks, Rachel, for that introduction. I'm so happy to be here, and thank you for welcoming me to this really cool symposium. So glad you're all here. We are going to talk for the next 30 minutes about how we cope with stress. And this is something that is coping with stress is not unique to folks who have lung conditions, certainly. And it's something that we all have to deal with as humans. But we're going to talk a little bit about where it comes from and what we mean by stress. Let's talk a little bit about why you're feeling stressed or more stressed than usual. Then we're going to spend quite a bit of time talking about tips for coping with stress. And these are tips that some of them are more specific to folks that have a lung condition, and many of them are more general to pretty much anybody, friends, family, and whoever else would benefit from coping strategies for stress. And then hopefully we will have time for a little bit of a discussion. All right, so let's start by defining what we mean by stress. It's we throw this term around a lot, and that's fine. It's a very broad term, and it essentially refers to a feeling of mental tension or anxiety. And it is a normal reaction to life events. It is impossible to eliminate stress from your life entirely. In fact, you actually don't really want to eliminate stress from your life entirely. Temporary stress is not a bad thing. Think to times where you have had, say, a deadline at work or with your family obligations or something like that, and you felt a little bit of stress, but that stress helped you sort of get going, meet your deadlines, do what it is that you needed to do. So a little bit of stress for a little bit of time is actually helpful for us to get moving and get the things done that we need to get done. The problem with stress, this feeling of mental tension, this anxiety, if it's too much or for too long, that can make us ill, or it can make our illnesses work. So that's why we have talks like this to talk about stress and how we manage stress. Of sources of stress, and we're going to talk about some examples and take it from there. So here are the first three sources of stress, and if I'm cutting out, let me know, because internet connection is unstable, so hopefully I'm still with you. But here are three places that stress comes from. The environment, and by environment, I mean everything that's out there, okay? Everything that happens in the world around us, okay? Then there are social sources of stress, and social sources of stress, that refers to things that other people do or don't do that make our stress worse. And then there are physiological sources of stress, and physiological sources of stress just refer to things that happen in our body or our physical symptoms. So those are 3 sources of stress. But the 4th source of stress, and in my view, the most important one, are our own thoughts, okay? Thoughts are the things that we tell ourselves. That's our internal running commentary about what's happening out there in the world with other people in our bodies. Our own thoughts about these events have a big effect on our stress. As a matter of fact, I will argue with you that it is not these things, environment, social, physiological, it is not these things alone that cause stress. In fact, it is our thoughts about them that cause our stress. So let me show you what I mean. So here are some examples of sources of stress. Environmental, I have COVID. I should have put that like 3 times, right? The last few years with this pandemic, even though things seem to have gotten better, I'll put a pin in that, we'll talk about that in a moment, has been a major source of stress, okay? And then politics and news. We live in very difficult times. It feels like times get even more difficult. It can be very stressful to look and see what's going on sort of out there in the world. And so politics and news is a major source of stress. And then I have weather there, particularly for folks with lung conditions. Changes in weather, and you know this better than I do, changes in weather can actually make your symptoms better or worse, and that can be a source of stress. And then I have one that's an example here that's common to almost everybody, traffic, right? Driving. So I think this is an example of a source of stress that everybody can relate to. You're sitting in traffic wherever you live in the country, and if you may notice that your muscles start to get tense, your shoulders start to tense up and things like that, okay? And then there are social sources of stress. So again, social sources of stress include what people do or don't do. And so these examples might include loved ones who don't necessarily understand your condition. You know, COPD and chronic lung conditions often are invisible, okay? People don't really have a sense of what you may be going through. And they may not really understand, they may really underestimate some of the things that you're having to struggle with. You also know that the opposite can happen. There may be people in your lives who are a little bit too helpful, who are a little bit too solicitous, who offer or to do things for you that you could probably do yourself, okay? Believe it or not, that can be a source of stress, and we'll talk about why in a moment. And then other social sources of stress include other people just being inconsiderate or rude. This could be family or friends, this could be strangers. I had an Amazon driver yell at me the other day. That was stressful, you know. So just living in the world and coming into contact with people who are not always kind to one another, okay? And then physiological sources of stress. So this is anything that happens in your body, okay? So for folks with lung conditions, shortness of breath is a big one, as well as fatigue. Other things like pain. If anyone here has struggled with post-COVID or long COVID symptoms, all of the cluster of symptoms that can happen after a bout with COVID, that can be a physiological sources of stress. But then the thoughts, and again, it is the thoughts, the sort of internal dialogue you have about these things that actually contribute to your stress. So, for example, a common thought that many of you may have had over the last few years is, I'm going to get COVID and I'm not going to survive, okay? Or I can't do the things I think I should do, okay? Or in response to sort of loved ones maybe being a little bit too helpful, doing things for you that you could probably do yourself. My family thinks I'm an invalid. You know, those are the sorts of thoughts that can make our stress worse. Or in response to what's happening out there in the world, this thought of people are killing each other. So these are examples of our thoughts, and these thoughts lead to feelings, and those feelings include being scared, angry, lonely, sad, worried, hopeless, and helpless. So you can see here the sort of chain of events that happens that leads to our stress. Something happens out there in the world, something happens in an interaction with somebody else, something happens in our bodies, we have thoughts about them, and those thoughts lead to these feelings and stress, okay? Here's another example of sort of the connection between thoughts and stress. And this is really specific to folks that have a chronic lung condition. And this is called the fear dyspnea cycle, dyspnea being an unpronounceable word for shortness of breath. And here's how it goes. And you know, all of you who on this call who have a lung condition know exactly what I'm talking about here. You have a shortness of breath episode, or you feel short of breath. What does that do to your anxiety or stress? Does it make it better or worse? Typically, it makes your anxiety worse, right? The problem is, what happens to your shortness of breath when you're anxious? Does it get better or worse? It gets worse, okay? So this is a vicious cycle, or the spin cycle of the washing machine, where you feel short of breath, and who knows what comes first? You know, maybe you're feeling a little bit anxious and you get short of breath, and then the cycle goes, or you start to feel short of breath, you feel anxious, and now the cycle perpetuates. What drives this cycle in large part, are our thoughts, or the reactions that we have to feeling short of breath or feeling anxious. So those thoughts can include things like, is this it? I've had a lot of folks with chronic lung conditions describe feelings of, feeling short of breath and having thoughts like, this is it, I'm going to die. Okay. This is finally the end for me. Okay. Or I'm going to have to call 911. Right. I need help. Or I'm getting worse. My condition is getting worse. I'm not getting better. Is it any wonder that thoughts like this drive the cycle, that make the anxiety worse, that can make the shortness of breath worse, and so on and so forth? So your thoughts have a really big effect on your back to kind of how, okay, great. What do we do about it? But first, let me also say that not only can stress be a man cause problems with our bodies, with our thinking, and with our behaviors. Okay, so stress can actually cause or make headaches, muscle tension worse, fatigue, trouble sleeping, stomach problems. Okay, those are some common symptoms of stress. And then in terms of thinking problems, you can have problems concentrating, difficulty making decisions, sometimes even about everyday things, or forgetfulness. And then the unhealthy behaviors that can be caused by stress include eating too much, or the opposite, skipping meals, not losing your appetite, drinking more alcohol, maybe smoking or going back to smoking, or using drugs. Okay, so these are all the sort of the negative consequences of stress and the effect that it can have on our bodies, on our brains, and our behaviors. All right, that's all well and good, but how do you manage our stress? So we're going to talk about some strategies. One sort of question I have for you is, do you always have to pay attention to your thoughts? Do you always have to assume that your thoughts are telling you the truth? Because oftentimes our thoughts, what we tell ourselves, is not always true. Or our thoughts use very extreme language or can be exaggerated. Okay, so here's some examples. I'm going to die. Here's a thought that has not yet come true, right? Or else you wouldn't be sitting here. Or I'm an invalid. Invalid's a really strong word, right? But it's thoughts like this that can make our stress worse. So our thoughts can use extreme language, can exaggerate, or can be patently false. But we always end up believing our thoughts. So do you always have to pay attention to your thoughts? So one way to manage stress is to kind of not always believe that your thoughts are telling you the truth, or even talking back to your thoughts. So here's some examples of ways that you can talk back to particular thoughts you might have. What are the chances that I'm going to die today? Okay, didn't die yesterday, didn't die the day before. What are the chances that that's going to happen today? What would my best friend say to me in this situation? And this is reserved for thoughts where you're feeling bad about yourself, or you're feeling you didn't do something that you're supposed to do, or just a lot of just sort of negative comments about yourself in your own head. Sometimes it's helpful to think about, like, what do people who love you say to you in a situation like this? Okay. And then looking for evidence that contradicts the thought that you have. So what's the evidence that I'm not an invalid? What were the things that I have been able to do or that I did do today? Okay. Or in response to the thought that people are terrible, people are unkind, killing each other, whatever, everyone's rude to me. Looking for evidence of haven't some people acted kindly, and if you kind of look for that, you're going to find examples that are opposite of what your thoughts are telling you. Okay, so you can talk back to your thoughts, or you don't even have to get that effortful. Can you simply watch your thoughts come and go? Okay, instead of believing every thought that comes into your head. So I have sort of like a photo here of clouds in the sky, and that's really what I'm talking about with our thoughts. Like our thoughts kind of drift in and out of our head, only to be replaced by another thought that comes along. Can you get to a place where you're just sort of watching your thoughts? You're not sort of jumping on those clouds, right? And then you're just sort of watching them go by, maybe even being curious about them, but not necessarily getting attached to them and not believing them. Okay, easier said than done, but it's a practice that can actually help manage your stress. Pursed lip breathing can also help with stress. Pursed lip breathing, now many of you maybe know what this is because it's been taught to you to be helpful with shortness of breath. And here's the great news about pursed lip breathing. It can also be helpful for stress. So let's just review it real quick. So you just sort of find a relaxed body position in whatever position you are, and you breathe in slowly through your nose if you wish for 2 or 3 seconds. And then when you breathe out, you purse your lips, almost like you're blowing a bubble or blowing a balloon, and you breathe out through your mouth a little longer than your inhalation. Okay, so now, what does that do? It empties your lungs, which is a good thing, and kind of helps make room for the next breath, which is why it helps with shortness of breath. But that long, slow exhalation also turns on your body's stress response system, your body's parasympathetic nervous system. This is the system in your body that helps to relax you. So when you take a long, slow out breath, it actually turns on that system. So that's why pursed lip breathing is great, not only to help with shortness of breath, but to also start to induce that relaxation response. Okay, so try a couple of pursed lip breaths when you're feeling moderately stressed. And then I want to go through a brief awareness exercise with you. And this is another kind of quick and easy. Well, I don't know, you may or may not find it easy, but it's yet another thing that practice kind of helps. But this is an awareness exercise that can help with stress. And you don't have to close your eyes or anything like that for it. As a matter of fact, it's better that you leave your eyes open because we're going to use our eyes. We're talking about our 5 senses, and here's how you do it. So you're just, wherever you are, as you're sitting, pick out 5 things that you can see just around you. Okay, you see the computer screen, you see a window with a bird outside. Okay, you see the clock. Okay? 5 things that you can see. And now turn your attention to 4 things that you can touch. Okay, you could touch the chair or the table in front of you. You can touch an item of clothing that you're wearing and feeling its texture. Maybe you just put hand sanitizer on your skin and you can feel the cooling of your skin. Okay, acknowledge any 4 things with your sense of touch. Now, what are 3 things that you can hear? You hear the sound of my voice. Maybe you hear the fan in your computer. You hear the heating or the air conditioning on in your house. Okay, engaging your sense of hearing, listening carefully, and picking out 3 things that you can hear. And then 2 things that you can smell. Okay, maybe you smell the remnants of the last meal that was cooked in your house. Okay, maybe the soaps or hair products that you're using. Okay. Smell is a powerful sense that can command our attention. And then finally, what is one thing that you can taste? Maybe you're still tasting the toothpaste that's in your mouth. If you have coffee or tea handy or water, take a sip and notice what it tastes like or the absence of taste. So that's the 5, 4, 3, 2, 1 exercise. Okay. Something that you can do just while you're sitting there to help reduce your stress. Okay. Why is this helpful for stress? So what we just did was an awareness or a mindfulness exercise. And why mindfulness or how mindfulness might work is kind of in this way. So here you are in the middle. And most of the time, we spend a lot of time in our heads with our thoughts. Our thoughts, as we've just talked about, can be things that we're sad about that happened in the past. They can be worries about the future. Okay. They can be worries and sadnesses about big things. They can be little things like, what am I going to have for breakfast today or lunch or whatever it might be. But we spend a lot of time in our thoughts. When we do a mindfulness exercise, for example, where we engage our 5 senses, it's a little bit of a mental health break, a little bit of a vacation from all of those thoughts, worries, and sadnesses. So when we focus our attention on our senses, we can take a moment to take a break from the thoughts and worries and sadnesses. And even that little break can actually help relax our bodies and relax our and improve our stress. Okay, so try that awareness exercise next time you're feeling mildly or moderately stressed. All right, so that's mindfulness. You may be wondering, is it helpful for people with COPD? And the answer seems to be yes. There are several research studies that report that a mindfulness practice like this can help reduce shortness of breath. And this was a study that was done with a 20-minute mindful breathing exercise. It can help people physically and mentally kind of slow down your thoughts, slow down that tension that we carry in our bodies. Mindfulness has been shown to decrease reports of just general psychological distress in folks with COPD and increase feelings of self-compassion, which is really important because we get very, very hard on ourselves when we struggle with a lung condition. And there also seems to be some evidence that mindfulness may actually prevent disease-related increases in biological inflammation, which is a really positive thing. So there has been science to suggest that mindfulness awareness exercises, kind of like the one we just did, can be helpful for folks with COPD. If you are interested in learning a little bit more about mindfulness, there's a ton out there. All you got to do is Google mindfulness. But if you want to some more kind of formal resources, you can Google UCSD Center for Mindfulness, UC San Diego, which is my affiliation, but lots of other universities and hospitals and medical centers have centers for mindfulness. This is just one example. So if you Google it, you'll come up with the website. There are lots of free videos and audios and things like that that you can use if you're kind of interested in dabbling in mindfulness. Okay. And then let's talk a little bit about sort of a philosophical way to manage our stress. We talk a lot about acceptance to cope with challenges in our lives, but acceptance is a very difficult word. Okay. And I have a hard time with this word. So, you have this thought like, I have to accept my lung disease. Well, the fact is that you don't want your lung disease and you do not want to accept it. All right. So we get very caught up in this, like, I have to accept, but I don't want. Okay. But instead of wanting, in this language of wanting, can we talk about willingness? All right. And here's what I mean. Even though I didn't want my lung disease, am I willing to do what it takes to live a meaningful life with my lung disease in hand? So the willingness language is kind of what I want you to think about next time you're thinking about wanting or not wanting things. So for example, lung disease, you're supposed to exercise, right? It's a big part of managing and living with chronic lung conditions. And we get caught up in like, do I want to exercise today? And 9 out of 10 times the answer for me anyway is no, I don't. But are you willing to exercise today in the service of your health, in the service of what's important to you? Okay. So you don't have to want to exercise. Okay. What are you willing to do? in the service of your health? Okay. What else are you willing to do in the service of your emotional health, in the service of managing your stress? Okay, so step back from this wanting. I don't want to be active. I don't want to go outside. I don't want to exercise. I don't want to engage with my social activities. What are you willing to do? Other tips for taking care of your emotional health, physical activity, no surprise here. Keep moving and get outside if you can. Not only is physical activity important for your lung condition, but it also helps reduce stress hormones. Okay, so a walk, even a short one, even one around the block. Okay, starting really slow if exercise is overwhelming for you. We spend a lot of time sitting. I know I spend a lot of time sitting. So setting an alarm or reminders to stand every once in a while. So even if walking seems overwhelming for you, can you set yourself some reminders on your phone to just stand up? Okay. You know, not surprisingly, there's a smartphone app you can use for this as well. If you use a smartphone, it's called Stand Up, the work break timer. I don't have anything to do with this app or its development. I just thought it was interesting. Or you can just simply set a alarm every half an hour or something like that to remind yourself to actually stand up. Okay. And then getting outside. Natural sunlight is very important. It helps regulate our mood and our sleep. Okay. So getting out there, I'm not talking about going out and getting sunburned, but can you step outside for a little while and get some of that vitamin D from natural sunlight, which is going to help regulate your mood. Just keeping an eye on the time. All right. Another way to manage stress. Plan your day, set a routine for yourself. Okay. Keep a regular routine for meals, bedtime, wake up and time, physical exercise, time outside. Okay. Try to structure your day as best you can. Getting creative. Is there a hobby you'd like to try? An old hobby you'd like to try? Again, a lot of, us during the pandemic kind of dropped some of the things that we like to do that were not inside the house or whatever. Is there anything that you feel comfortable picking back up? Okay. Or learning something new. For example, learning how to use technology that's new to you. Okay. And then planning, scheduling time for recuperative exercise kind of activities like relaxation, mindfulness, as we just talked about, or prayer, if that's something that's meaningful to you. Okay. So planning your day. Keep having some kind of a structure. I'm not saying you got to plan every hour, but have a little bit of a routine. Okay? Staying connected to others is huge. Okay. There are lots of ways to connect to folks. The good old fashioned phone call, but also these days, Zoom, Skype, FaceTime, we all kind of were forced to do this during the pandemic. Send an email, a text message. When was the last time you actually wrote a letter? If a letter is too much, how about a postcard? Checking social media does not count as staying connected to others. Okay, that's fine. Many of us use Facebook. Some of us use Instagram. Some of us use, other platforms like Twitter/X, whatever it might be. But if that's all you're doing to stay connected to others, try these other things as well. Okay. Are you feeling stressed by news and current events? Many of us are. How do we manage this? Try to set a time limit for how much news you listen to or how much time you spend on social media. Okay. We have a saying called doom scrolling, when you're kind of on like a news feed or Facebook or whatever, and you're just like scrolling and all you're seeing is bad news. When you find yourself doing that, time to stop and take a break. Also, to make sure that you're getting news from trusted sources. It is okay to want to stay informed. I'm not telling you to just not, to stop watching the news or whatever, if that's something that you want to do, but limit yourself, take a look at your sources, be aware of how much time you're spending on getting your news sources and check in with yourself about how you feel after listening to the news or watching the news. That can be very helpful information. A few quick tips about trouble sleeping. You're not alone in terms of trouble sleeping, but here are some quick tips. If you're waking up because you're hungry, obviously eat a light bedtime snack, which will avoid awakenings from a drop in blood sugar. Sleeping in a quiet, dark, cool bedroom. Okay, don't keep your bedroom too warm, and no light. Okay, keep your phone away from you. Put it someplace else. Okay, light tells our body it's time to wake up. Okay, comfortable mattress, comfortable temperature. Like I said, the bedroom should be slightly cool and your bed should be warm. Avoid trying to sleep. We can talk a lot more about that, but if you're in bed tossing and turning, time to get out of bed and try something else. And limit and avoid napping. Napping is a great thing, but if you are napping during the day and having trouble sleeping at night, it's time to limit your naps, or at least don't nap in the afternoon. As we talked about, sort of not trying to sleep, reducing time in bed. Okay, if you cannot sleep, get up. Okay, go do something else and then come back to bed when you're sleepy. Trying to keep a regular sleep-wake schedule is really important, especially your wake-up time. Okay, if nothing else, try to wake up at a consistent time, because that'll stabilize your body's rhythm and reset your clock. Okay, speaking of clocks, if you are having a hard time sleeping and you've got a bedroom clock that you keep looking at to see, have I slept? Have I not slept? I slept for 10 minutes. I slept for 5 minutes. I haven't slept for hours. Eliminate the bedroom clock or turn it around. Okay, so you can't see it. Watching the clock can lead to worry, which activates your mind and makes it difficult to sleep. And then avoiding caffeine, nicotine, or alcohol. All of these things can actually disturb sleep. Caffeine and nicotine, you think that's a no-brainer, doc. Yeah, I know I should avoid caffeine. But alcohol, many people use a little bit of alcohol to get to sleep. Okay, fine. But what happens in your body is when the alcohol wears off, even if it's a small amount of alcohol, it actually signals your body to wake up. So if you're having a little bit of a nightcap, going to sleep, but waking up later, take a look at that, to that alcohol intake that might be actually contributing to your waking up. And then considering all of these things to make your sleep more restful, like white noise, earplugs, or even a mask. And then finally, keeping a gratitude and compassion journal. It can be difficult to find those moments, but at the end of the day, write down, type, or audio record, maybe even on your phone, at least something that you're thankful about. And these can be really small things, okay? Or a pat on your back, your own hooray, my hooray, okay? What did you do today? Did you do a healthy behavior? Or did you not do an unhealthy behavior? Again, these don't have to be big accomplishments. These can be small things. I walked outside for 5 minutes today. That's my hooray. Or even a moment of kindness or compassion that you noticed in someone else, and noticing that other people sometimes can be kinder during the times of crisis that we've had recently. So keeping that gratitude and compassion journal can sort of help balance some of the stress that you have about what's going on in the world with other people and with yourself. This is an important slide. Know when to get help. We all feel stressed. We all feel sad from time to time. But if you're feeling depressed or down most of the day or nearly every day, and it's lasting a week or two, it's time to talk to your doctor and to get professional help. Or if you're feeling anxious or worried all the time. Again, we all get stressed from time to time. As we talked about, temporary stress is not a bad thing, but if you're worried and anxious all the time, it's getting in the way of your ability to do things, to sleep, and so on and so forth. Thoughts of hurting yourself are always a reason to seek prompt professional attention, okay? Talk to your doctor, go to the emergency room, certainly, if you're having thoughts about hurting yourself. Watch any increase in behaviors like drinking alcohol, using drugs, maybe overusing prescription medications. Those are all reasons to get help. And please get in touch with your doctor. And like I said, please go to the emergency room if thoughts emerge about hurting yourself. So I'm ending. Stress is a normal part of our lives. It has been an exceptionally difficult few years just with the pandemic and recovering from that. But you can learn to recognize where your stress comes from, especially your own thoughts and reactions to what's happening around you. And you can manage those. Many things you can do to manage your stress and importantly, continue to live a meaningful and valued life with your lung disease in hand. And the question is, are you willing to try them in the service of your health and well-being? So that's all I have. I very much appreciate your attention, and I'm happy to take questions.
Thank you so much. If you have any questions, please put them in the chat and we'll go through a couple. Okay. One that we have is, how are support groups helpful and how can I find a support group?
Yeah, so thank you for that question. Support groups can be very helpful. You know, it's great to have well-meaning family and friends and loved ones who, you know, love you, care about you, all of those things. Sometimes it's helpful to talk to people who have been through what you have been through, or going through what you're going through, and understand that from a perspective that your family and friends may not have. So support groups can be very, very helpful. In terms of where to find one, it kind of depends on where you live. There are a lot of online support groups. There are a lot of Facebook-based support groups. Be careful, kind of do your research, and make sure that if you're on sort of an online-based support group, if it's making you feel worse, not better, that's a sign maybe that's not the support group for you. I know that you know, I think it was the American Lung Association had like the Better Breathers Club for a while, and still do. So you may look up Better Breathers Club and see what the meetings are in your area. That's another source to get a support group. And talk to again, if you're having a hard time finding psychological support or support groups, talk to your physician, talk to your pulmonologist, and they may have some recommendations or referrals for you as well. But support groups can be actually quite helpful.
Great, thank you. One that we have is meditation in conjunction with mindfulness helpful for stress?
Yeah, definitely. So mindfulness is one type of meditation, if you will, and meditation is just kind of a broad term that refers to just kind of focusing on one thing, be it your breath, be it your senses, whatever it might be. So the literature has shown that that there's not a lot of research on other types of meditation to be effective for COPD, which is not to say that they can't be. It's just that most of the research has been done with mindfulness meditation, which is more, again, of that sort of present moment awareness. And that's been shown to be helpful. Honestly, anything that slows you down, that has you focus on your breath a little bit, that has you focus on what's going on in the present moment, is something that's going to be helpful and therapeutic for you. So you don't have to get fancy with it.
One that says, is there such a thing as a cortisol imbalance, and is there anything that can be done about it?
Yeah, interesting question. Cortisol imbalance. Okay, well, what is cortisol? Cortisol is is a hormone that our body produces when we are stressed. Again, it's sort of an adaptive thing. It's a hormone that's there for a reason. In terms of like cortisol imbalance, I'm probably the wrong person to ask. I think when we're stressed, we produce cortisol, and when we're chronically stressed, we produce a lot of cortisol, and it kind of it sort of leads to all of those sort of negative physical effects, or many of those negative physical effects that on the slide that I showed you earlier. So I guess you could talk about that as an imbalance, and how do you correct that cortisol imbalance? I can, again, sort of review the things that we can do behaviorally. I don't know if there are other ways to sort of correct a cortisol imbalance. That would be a good question, I guess, for a physician. But keeping in mind that that cortisol is reflective of stress, and if you do sort of behavioral strategies to manage your stress, you can help reduce your cortisol and reduce the negative effects of chronically high cortisol on your body. So I know that doesn't really answer your question all that well, but.
Great, thank you. If I only have time for one thing, what practice should I prioritize in my daily routine to reduce my stress and anxiety?
What a great question that is. If you only have time for one thing, I would actually try some kind of a awareness exercise like the 5, 4, 3, 2, 1. Okay. Or any other type of relaxation or mindfulness or meditation practice. And again, there are lots of apps that you can use to do that. 5 minutes of some kind of an exercise that helps relax your body, has you focus on your breathing, which is hard to do sometimes with folks with lung disease, can help sort of, like I said, turn on your body's relaxation system and can have lots of positive effects on your health. So, if all else fails, sit down and try a 5, 4, 3, 2, 1. And if it doesn't work, try it the next day. And if it doesn't work, then try something else.
Great. Are there any dietary changes that can positively impact both my COPD and stress levels? And along with that, how do we know what food causes inflammation?
Yeah, so there's a lot of research on sort of diet, stress, inflammation, and that sort of thing. Again, it's not my area, so I hesitate to sort of comment on it and give you the wrong advice. Yeah, so I think in terms of like diet and stress, watch your caffeine intake, watch your sugar intake, watch your alcohol intake. Again, I think these are things that we use to sort of soothe ourselves, to wake us up, to put to relax us, but they can have negative effects on our stress for sure. And in terms of dietary changes that can be beneficial for COPD, I would definitely sort of refer to your pulmonologist for those questions.
Great. Another one we have is finding a mental health professional to help manage my stress seems overwhelming. Do you have any suggestions on how to go about the process?
Yeah, thanks. It can be overwhelming for a number of reasons, because sometimes it's just there are maybe barriers to finding a mental health professional. There may be financial barriers, there may be insurance barriers and things like that. I think step one is really to talk to your primary care doc or your pulmonologist and share with them that you would like to talk to a mental health professional. And very often your physicians are maybe in a hospital system that has behavioral health or mental health resources that they can point you to. So that might be honestly the first place to start. And with anything that's overwhelming, starting small is important. Okay, so your goal is, I want to find a therapist. That's a really overwhelming goal. Start small. Okay, the small goal is, next time I talk to my doctor, I'm going to inquire about getting mental health resources, and that's going to be my goal. That's it. Okay, that's an easier goal to meet than I need to find a therapist, I need to find a psychiatrist. Okay, so set that goal for yourself. Once you meet that goal, that may open up a door for you to start to get some help. Again, it's hard, like, it kind of depends on what's going on with your insurance. A lot of people on their back of their insurance card, there's a behavioral health phone number that you can call. That can be your goal for the week. All right, all I'm going to do this week, the only thing I'm going to focus on in terms of my goal of getting mental health help is to call this number. That's it. Okay, and then you've started the process of going on that path.
All right. I'll do one more question. Can stress and anxiety interfere with other chronic health issues besides COPD?
Everything. Absolutely. Absolutely. Stress and anxiety chronic stress can make any other condition more difficult to cope with, any other health condition. So it's important for all of us to manage our stress, not just folks with lung disease, but all of us. So absolutely.
Great. Thank you so much, Dr. Manassian, for a wonderful presentation. Any questions that you may have after, you can still submit them and we will include them in our post-event recap and share with all attendees. We'll now take a quick 5-minute break and then come back to give some appreciation to our caregivers. Thank you so much, Dr. Manassian.
My pleasure. Thanks all.
All right, welcome back, everyone. Today is not only World COPD Day, but November is also National Caregivers Awareness Month. So we would like to spend some time. If you would like to, please give a shout out to your caregiver or let us know if you are a caregiver in the chat so that we can thank you for all you do. So if there's anyone in the chat that wants to get a little shout out, let us know. Okay. If you have any that you think of, just put them in the chat and we'll give them a shout out. So we at RHA would like to spend this time recognizing the amazing, valuable, and selfless work that our caregivers do daily. We just want to read a quick quote from the National Family Caregiver Month Presidential Proclamation, which says, "Caregivers are the backbone of our nation's long-term care system, doing essential work with devotion, often at a great emotional and financial cost. We owe them. It is time to bring their service out to the shadows and celebrate and support them in living their own happy, healthy, and fulfilling lives." So as more than 50 million Americans provide caregiving, we would like to celebrate them all by noticing, supporting, and advocating for them. To all our caregivers here today, I know you guys are there, but we recognize all your hard work and strength in caring for others. And while much attention has been paid to healthcare and support needs of people living with COPD, less time has been devoted to considering and addressing the needs of their informal caregivers. So informal caregivers are people who provide some type of unpaid, ongoing assistance with activities of daily living or instrumental activities of daily living to a person with a chronic illness or disability. And in many cases, these are family members who possess a strong personal and emotional connection with the persons living with COPD, but often lack external support for their loved ones. So let's dedicate some time this month to focus on supporting our amazing caregivers. Some ways that you can show appreciation and support to your caregivers can include listening and not giving any unsolicited advice, offering specific help and showing up for them, becoming an advocate and voting for advancements in caregiver support, be encouraging, and also acknowledging and empathizing with them. If you're a caregiver, please feel free to put what makes you feel appreciated in the chat, and as they come in, I'll read them out. Maybe this could include somebody asking if you are okay, if you need help, or a simple thank you for all you do. RHA's president and CEO, Joel Afric, knows firsthand what it means to be a caregiver. I would like to invite him to speak a little more on the importance of supporting our caregivers today.
Thanks so much, Cherna. The reason I know firsthand what it means to be a family caregiver is that my late father had COPD for many years prior to his death in 2022. And my mom, prior to her death, a year before my dad, was my dad's family caregiver. After my mom died, I became the family caregiver for my dad. RHA started its examination into caregivers in large part based on my firsthand observations of the interplay between my mom and dad, the desire of caregivers to do the very best they can for their loved ones, but not always having the resources that can best allow them to do the best they can. What types of things are we talking about? We're talking about things like medication management, keeping the home safe when a loved one is on supplemental oxygen, how to make the most effective use of a medical appointment, what to do following the hospitalization of the patient. Are you prepared, and how you can best be prepared for when the person comes home? And finally, and this is really important, how can caregivers properly engage in self-care, even when they are often exhausted from their informal caregiving duties. What RHA found when we examined this issue was startling. First, and it may not surprise you, but caregivers of COPD patients are experiencing rates of anxiety and depression that are even greater than the rates of anxiety and depression among the patients. Second, our caregivers feel unprepared for the challenges they face in their caregiving. And finally, there were virtually no resources developed for these caregivers. And that was the impetus for RHA's development of the first comprehensive resource for family caregivers of people living with COPD. We found that more than 70% of the COPD patients in the US have informal caregivers. And I'm now pleased to turn the mic back to Rachel and Cherna to speak with you about the resource that RHA developed for caregivers.
Thank you so much for that, Joel. Now we will be giving a quick overview of our toolkit and the modules included to support caregivers. We'll share a link with everyone of the digital version in the chat and in the follow-up email for you guys to visit. This was in collaboration with LMBB, and the toolkit modules are now animated and free online. So we will show you some video examples of our animations later on. The first module is titled, How Do I Help the Person I'm Caring For Manage COPD? This module covers COPD causes and symptoms, medications on how to use them, other treatment options for COPD, resources to help people quit smoking, and information about important vaccines. It also covers nutrition and COPD. So this module teaches important signs to look out for example, a flare-up of COPD, what that may look like. You may show an increase in symptoms, difficulty breathing, or shortness of breath. And it also gives tips on how to stay away from irritants, how to speak to your doctor about COPD flare-ups. If you've ever wondered if your symptoms of COPD are related to your COPD or if there's something else, this toolkit can guide you through those symptoms and how you're feeling, and if it can be attributed to a COPD flare-up or some other condition. Additionally, it has step-by-step tutorials on how to use a spacer with your inhaler and nebulizers. So now we will show a quick animated module that is available for everyone online.
When you or someone you care for is diagnosed with chronic obstructive pulmonary disease, or COPD, information makes all the difference. COPD is a serious lung disease, making breathing hard. It gets worse over time. Symptoms may include shortness of breath, ongoing cough, wheezing. Although there's no cure, COPD can be controlled. As a caregiver, you can improve your loved one's well-being. Keep in regular contact with healthcare providers. Understand the overall treatment plan, including how to use prescribed medicines and other treatments like breathing exercises or pulmonary rehabilitation. Support a healthy, smoke-free lifestyle. Encourage approved exercises, a healthy diet with plenty of water, and stay on top of vaccines. Caregivers who know what to expect can give better care to their loved ones with COPD. Learn the facts about COPD. Visit the COPD Caregivers Toolkit to learn more. nhlbi.nih.gov/COPD-caregivers.
All right, the second module answers the question, what should I know about managing the home of somebody with COPD? And it walks through how to adapt your home after your loved one is diagnosed with COPD, how to take care of challenges that caregivers may face when COPD patients have to use oxygen, outdoor irritants and allergies, and tips for managing COPD in warm, cold weather. This module has great guidelines on how to make your home safe for somebody living with COPD and goes over common triggers such as tobacco smoke, pet dander, and dust and mold, and how to manage them through proper cleaning, heating, cooling, and which products to avoid. If you utilize oxygen, this module can help you manage your supplies and ensure proper use to prevent any failing or avoid hazards that may come up. So here is another animated module for Module 2.
If you're caring for someone with chronic obstructive pulmonary disease, or COPD, you can help make sure their home is supportive and safe. People with COPD tend to spend more time indoors. Triggers in the home, like smoke, dust, or pet hair, can make COPD symptoms worse. So take steps to manage them. New equipment may bring new concerns. Oxygen tanks can be a fire hazard, so be cautious when cooking. Take care to manage oxygen tubing and learn how to safely store, maintain, clean, and manage oxygen supplies. Other equipment like walkers or wheelchairs may require changes, like moving rugs or furniture. Household chores can be harder with COPD. Recruit family, friends, or neighbors to help around the house and yard, or with pet care and grocery shopping. With the right strategies, you can create a safe, comfortable home for someone with COPD. Visit the COPD Caregivers Toolkit to learn more.
All right, on to our third module, which aids in doctor's appointments and answers, how do I prepare for a visit to the doctor? In this module, we talk about what questions to prepare for doctor's visits and how to track medications, vaccinations, and COPD symptoms.
If you're caring for someone with chronic obstructive pulmonary disease, or COPD, preparing for visits to the doctor can help make the most of the appointment. Bring a list of questions for the doctor, like when to call the doctor's office and when to call 911. Come prepared with questions about nutrition plans, pulmonary rehabilitation, oxygen therapy, and other parts of care. Track medications and vaccinations. Bring a list of all medications and a record of vaccinations to every appointment. Track and tell the doctor about daily COPD symptoms, noting changes in breathing, coughing, activity level, appetite, and sleep. This can help the doctor create the best treatment plan for your loved one with COPD. Visit the COPD Caregivers Toolkit to find checklists and forms to help you make the most of doctor visits. To learn more, go to nhlbi.nih.gov/COPD-caregivers.
Our next module is Module 4, with how to help after a COPD flare-up or a hospital stay. This module covers how to recognize and prepare for a COPD flare-up or emergency, how to develop a plan for emergencies, and steps to take after someone has been hospitalized. This module can help you prevent flare-ups, and in the event of a flare-up, have a plan in place to make sure that you get the best possible care. And then finally, our last module, Module 5, is how do I take care of myself while managing somebody else's care? And this one is very important for focusing on the caregiver health and how a caregiver has to manage many roles. We talk about different ways caregivers can get support and manage their physical and emotional well-being while managing the health of somebody else. Module 5 is a way for us to recognize the needs of a caregiver. You may be a home health care worker, a personal assistant, a medical coordinator, a guardian, family member, or all of the above. With all of these roles, it can cause stress and anxiety. This module can help you recognize mental health and how to maintain it through different practices and even support groups.
Caring for someone with chronic obstructive pulmonary disease, or COPD, is important. But it's also important to take care of yourself. Maintaining your physical and mental health can improve your well-being, allowing you to be a better caregiver. Manage your stress by fitting in some me time. Exercise and move your body by doing things you enjoy. Get enough sleep. Stay on top of your own health needs. Recognize signs of stress, anxiety, and depression. What you're doing isn't easy. Create a support system for yourself and your loved one. Build a care management team that includes backup caregivers, help with household duties, and local senior support programs to reduce your load. Your physical and mental health make a difference for you and your loved one with COPD. Find more information about caregiving and COPD. Visit the COPD Caregivers Toolkit to learn more at
If you have a question or any comment, please put it in the Q&A box, and then we can answer it. For these animated videos and a digital version of the toolkit, you can go visit NHLBI online or the link in the chat. And you can also order a hard copy through RHA's website. We will also share all of these resources and with links in the post-conference follow-up. Again, we want to say thank you to all of our caregivers, and we are now going to move on to our third and final webinar. I would like to introduce our final speakers for today's event, Dr. Stephanie Lebeds and Dr. Lori Wilkin, who are presenting on COPD medication and surgical options. Dr. Lebeds is a pulmonologist at the University of Illinois Hospital and Health Sciences System, UI Health, and treats patients with a variety of lung diseases with a special interest in obstructive lung disease, such as COPD and asthma. Her research interests include medication adherence and addressing social factors that contribute to poor health in patients with chronic lung disease. Dr. Lori Wilkin is the director of Tobacco Treatment Center and a clinical pharmacist in the Lung Health Clinic at the University of Illinois Hospital and Health Science System. She is a graduate of the University of Toledo with a Bachelor of Science and doctorate degrees in pharmacy. She completed her residency at the University of Illinois at Chicago and teaches in the College of Pharmacy. Dr. Wilkin is passionate about helping patients with asthma and COPD improve their health. As a reminder, please submit any questions in the Q&A box, and please join us in welcoming Dr. Wilkin and Dr. Lebeds.
Okay. Myself, there we go. Hi, everyone. Thank you so much for joining us. Is everything okay?
Yes, we can see your slides and we can hear you.
Okay. All right. Dr. Labette and I will be going through medications today, an update for our COPD medications, and then talking a little bit about surgical options. We have a few goals for our talk today. Just wanted to start off with talking about the importance of vaccinations and quitting smoking and using some medications to help with quitting smoking if you are continuing to smoke. Discuss inhaled and oral medications, review the role of oxygen therapy for chronic obstructive pulmonary disease, and then finally wrap it up with some current surgical options if you have severe COPD. So I just wanted to make a big shout out for how important it is for everybody to get their flu vaccine. We're coming up on that holiday, Thanksgiving, where everybody's going to be joining together and in close contact with family members of all ages. And we just know that our children are not getting vaccinated as much as possible. So it's really important for all of you to make sure that you have those vaccines and give them some time to work. We're running into a crunch now with Thanksgiving being next week. So we need a couple weeks for those vaccines to really kick in. We know over the years that we've had a lot of evidence for the influenza vaccine to help decrease the risk of death and hospitalization in our patients with chronic obstructive pulmonary disease. So if you hate getting vaccinated and you only have to pick one vaccine, I guess maybe this one would be the top of the list. Our list continues to grow each year too, unfortunately. So for those of you who have had vaccines, you're ahead of the game. And you might be okay as far as not having to get as many vaccines. But our pneumonia vaccine was just updated this past year too. In the past, our pneumonia vaccine has been shown to decrease hospitalizations if you have COPD. There is a new one that just came out, the PCV20. And if you were already vaccinated, depending upon if you just have COPD or if you have other disease states going on, but it might be just a one-time dose that you need to get this new updated pneumonia vaccine. So you probably want to check with your pharmacist and your physician and decide whether you need this new pneumonia vaccine or not. The next one is our COVID-19. So it's looking like this one is ending up being a yearly vaccine like our flu vaccine. So if you haven't yet received your COVID-19 vaccine for this fall, I would highly recommend getting that vaccine. It looks like we are staying, I just checked the CDC report this morning and it looks wonderful. So shout out to everybody who's been getting vaccinated because it looks like for right now, knock on wood, it's staying at bay. You may or may not know about the Tdap vaccine. It helps protect the spread of whooping cough. And we've all heard little kids having that little barking cough that lingers around for quite some time. This vaccine is added to our tetanus, a vaccine that we should be getting every 10 years, and it's only a one-time thing. So if you haven't yet had that and you can help decrease the spread and the chances of getting the whooping cough if you get that little P part added to the pertussis part added to your tetanus vaccine. The next one is for all our folks that are over the age of 50. That's that one-time shingles vaccine, or actually it's 2 shots that will help protect you. And it's added to our expert recommendations for chronic obstructive pulmonary disease. So I just wanted to include that in the list. And then just coming out, but not yet in our expert guidelines, is the respiratory syncytial virus vaccine. And our chronic, all of you with COPD that are out there, you unfortunately are on the hot list of getting this vaccine. I just wanted to spend a few minutes talking about it. Like many of our other viruses that we have circulating around, it's an airborne virus and it presents just like we see our other stuff, with a runny nose, sore throat, aches, maybe low-grade fever. And in mild cases, it only lasts for about 5 to 7 days, but it can develop into a severe case where you might have to get hospitalized. And unfortunately, if you have COPD, you're at higher risk of getting a more severe case of this virus. And so this year, we're fortunate enough to have 2 companies putting out vaccines that can help. What we know of is possibly decreasing the severity of an infection, so a lower respiratory tract infection or getting a worsening case of this. It doesn't yet have evidence of preventing any hospitalizations or deaths from it, but again, these are brand new vaccines, so they're new and we don't have enough time to generate that kind of evidence yet. It is recommended for those over the age of 60 without high-risk disease states with decision-making with your physician. However, if you do have COPD, you should consider getting this vaccine. Right now, it's recommended one-time dose. We're not sure if it's going to be a yearly vaccine or not. And the symptoms, the side effects are just like the other side effects for the vaccines, the sore arm, the achiness for a couple of days afterwards. And then there have been some rare cases, very rare cases of atrial fibrillation and GBS, which is a neurologic inflammatory disorder. But again, it was like 3 to 10 cases out of like thousands of patients. So again, if you're concerned about it, you might want to talk to your doctor or pharmacist a little bit more about it. But I think the benefits of it far outweigh the risks. And then my next biggest shout out for help improving our lives is stopping smoking. We know that that's going to add years to your life. And it's our only effective thing right now for declining your lung function. So we really need to take advantage of that if you haven't yet quit smoking. I think that what I'm seeing in clinic, patients are coming in a little bit frustrated, having tried all of these medications that have been out for quite some time and really not being able to succeed. If you have been successful, please help others around you that haven't yet been able to quit. There are options where we're actually recommending, if you've only tried like something like a patch by itself, trying to use combination therapy. So, putting a gum or a lozenge with a patch, but also, if you haven't tried the oral medications yet, especially the varenicline or the Chantix, it's our most effective medication for helping patients with quit and smoke. And so if you haven't talked to your doctor yet about that, sometimes even if you were able to cut down with using the medication, but not totally quit, then we're using things like a patch and the varenicline together to help people totally quit smoking. So don't give up. And then the other thing is, if the medications were not helping enough to help you quit smoking, thinking about whether or not you are addressing your routine for smoking. So we know that the cravings is half the battle, and the other half is just changing up that daily routine. So making sure that you get support. If you're not one to get out of the house and be in a group setting, there are quit lines. I listed the Illinois quit line, but I realized some of you might be from other places. So there is a national quit line number that you can also call. But I also posted some websites that I think patients enjoy, because you can seek out text messaging, or you can be in a blog or journal how you're doing each day and get support from other people across the country. And then if you are a group kind of person and want to get out of the house, the Respiratory Health Association has the Courage to Quit programs listed on their website for different sites around the Chicago area. And then I also put out for our University of Illinois Health System, if you want to come in for individual appointments, that resources listed at the end of our presentation. I didn't want to leave though this site without addressing all the concerns with vaping and pouches and all those things that we are seeing out there marketed to all of us. Just realize that a lot of these products are made from the tobacco companies, the same companies that might have got you addicted to smoking cigarettes. The thought process is that vaping and the pouches might have be safer because you're not inhaling all of those chemicals from the smoke. But you may be trading one addiction for another. So they're putting high amounts of nicotine in those products that if you're trying to save money along with improve your health, that might not be the best way to go. We really don't know the long-term consequences of using these products either. And with that, I'm going to turn our talk over to Dr. Levetz.
Thank you so much, Lori. It's a pleasure to speak with everyone today. I'm going to review the different medication treatments for COPD, both inhaled and oral. We'll talk about oxygen therapy and a little bit about the surgical options to treat COPD. So first, starting with inhaled medications for COPD, this is really the cornerstone of treatment for COPD, and all patients with COPD should be prescribed at least one inhaler. The medications, inhaled medications, are delivered either via inhaler devices, which are little plastic devices, usually that you can hold within your hand, or a nebulizer device where you put a liquid medicine in it and it creates a mist that you can breathe in. There are two types of medications or classes of medications that can be administered via inhaler devices. The most important of which are a class of medications that we call bronchodilators. And these medications open up the airways by relaxing a muscle layer that surrounds the airways. So it essentially increases the diameter of the airway and allows more air to move. The second type of medication are anti-inflammatory medications or steroids. And these medications work by reducing inflammation in the airways. Next. There are a number of proven benefits to using inhaled medications to treat COPD. Perhaps the most important of those to patients is that these medications reduce symptoms. So people feel that they can breathe better and they're less short of breath when they use their inhalers. Inhaled medications also improve lung function and improve quality of life, both of which are important to patients. They reduce the risk of flare-ups or exacerbations of COPD. I'm sure many of you are familiar with what a COPD exacerbation is, but for those who are not, a COPD exacerbation is an acute episode of worsening COPD symptoms or the development of new respiratory symptoms that requires an increase in therapy. So inhaled medications for COPD reduce the likelihood that someone will develop one of these exacerbations. And finally, inhaled medications for COPD reduce the risk of being hospitalized for COPD. Thus, there are many benefits to using inhaled medications for COPD beyond helping people breathe better that are both important to patients and important to clinicians. Next. Treatment for COPD is different than many chronic diseases in that it involves kind of two different strategies for treatment. Doctors will typically prescribe two different inhalers, one of which is considered a controller inhaler and the other is a reliever inhaler. The controller inhaler is meant to keep symptoms under control for the long term and reduce flare-ups. The controller inhaler should be used every day, regardless of whether someone's having symptoms or not. Most medications in the controller inhalers don't start working right away. So don't worry if you don't feel anything right after using these inhalers. You should start to notice their effect within a couple of hours. And the effects will last anywhere from 12 to 24 hours, depending on the particular medication that you're using. Oftentimes, people will need a controller inhaler that has more than one medication in it, or they might need more than one controller inhaler to get the right combination of medicines. In contrast to the controller inhaler, reliever inhalers are intended to be used only as needed for symptoms. Therefore, they don't need to be used every day, but they can be used every day or even multiple times a day, depending on how frequently someone's having symptoms. The medications that are in reliever inhalers do start to take effect within minutes, so they're really great to use when you need quick relief from symptoms. However, the medications in reliever inhalers wear off after several hours, so they're not really good for keeping symptoms under control throughout the day. Think of your reliever inhaler as a little something extra that you can take from time to time to kind of get you through an activity or a setting when you might feel more symptoms. But if you have symptoms regularly, your doctor will probably recommend that you use a controller inhaler in addition to the reliever inhaler. Next. I borrowed this chart from our friends at the American Lung Association to give you an idea of all of the different inhaler options that we have to treat COPD. As you can see, there are dozens of different inhalers that contain either a single or multiple medications. There are also a number of different inhaler devices that can deliver the medication in different ways. So while your doctor will determine which types or classes of medications you should be on to treat your COPD, the particular inhaler that's right for you may be a very personalized decision. Next. And while it's nice to have so many different options, it can also be a bit overwhelming to know which of these inhalers is a good fit for you. There are important differences between many of these inhalers, so I'd like to go over some aspects of the inhalers that someone with COPD or a caregiver to someone with COPD should take into consideration when discussing their options with their doctor or pharmacist. Next. When I'm prescribing an inhaler for COPD, the first thing that I take into consideration is which inhalers are covered by the person's health insurance, or in other words, which medications or inhalers are on their insurance formulary. Even though there are dozens of inhalers available on the market to prescribe for COPD, health insurance companies don't always cover all of the inhalers and make them available to patients at a reasonable price. The health insurance formulary for a particular health insurance plan will list all the inhalers that are covered. So you will want to check to see if your inhaler that your doctor prescribed is on that list. If the inhaler is not on your health insurance formulary list, the cost of the inhaler is likely to be very expensive. And for most people, it's not affordable. If you aren't sure if a medication is on your insurance formulary, you can often find this list online, or you can call your health insurance company to see if the medication that you want to take is covered. Kind of closely related to health insurance coverage is the cost of the inhaler. Unfortunately, in the United States, there are limited options for generic inhalers, so the cost of most inhalers are very expensive if the inhaler is not covered by your insurance. And sometimes, even if the inhaler is covered by your insurance, it's still very expensive. So whenever I prescribe an inhaler, I always tell my patients, please, please, please call me if your medication is not affordable. I don't want you to go without your medication. If it's not affordable for you, then I can try to prescribe something different that might be more affordable. So if cost is an issue, or if the medication is not covered by your insurance formulary, it's really important to get in contact with your doctor to see if there's a different option. Other things that you should consider and bring up to your doctor or pharmacist are the frequency of dosing and the number of controller inhalers that you're using. Some of the controller inhalers are dosed once a day, whereas others are dosed twice a day. And if you're like me, it's much easier to remember to take your morning medication than your evening medication. So if you find yourself missing your evening dose, you may want to ask about an inhaler option that's dosed once a day to make sure that you're getting all of the doses that you're prescribed. Some people have to be prescribed more than one inhaler to get all of the medications that would be beneficial for them. However, there are more or an increasing number of inhaler devices that combine different drugs into a single device. So if you find yourself using multiple inhalers throughout the day, you can always ask your doctor or pharmacist if there are options to reduce the number of inhaler devices that you're using, because I believe a simpler regimen is an easier one to use for both the patients and ensures that they're getting all their medication. The type of inhaler device can be really important for some people because the different devices require different steps to use, and some of them are a lot more challenging to use than others because they require coordination and a different level of manual dexterity with your hands to use the device correctly. Some devices that have dry powder medications in them also require somebody to have a pretty strong breath to suck the medication out of the inhaler device. So many patients with COPD who have a weaker breath have trouble using these medications, and therefore they're not as effective. So the type of inhaler device can be really important in terms of usability and comfort and ease of use. And then finally, preferences are really important because sometimes patients have inhalers that they've been on for a really long time. They really want to continue to use them because they're comfortable with them. So all of these things are really important. And I would encourage you as patients or caregivers to people with COPD to bring up these topics to your doctor to see if they're a way to customize your treatment regimen to one that works best for you. Next slide. One of the aspects of inhalers that makes them really unique compared to other medications is that the effectiveness of inhaler medications depends on using the inhaler device correctly or having correct inhaler technique. Studies show that 50 to 80% of patients with COPD do not use their inhalers correctly. So chances are most people in the audience on the conference today are not using their inhaler devices perfectly. In my clinical practice, I would guess maybe 8 or 9 out of 10 patients that I evaluate are not performing all of the steps to using their inhalers correctly. And I always tell them it's not your fault. It's our fault as doctors because we don't take the time to show you how to use your inhaler correctly. And because of that, the medication isn't getting where it needs to go, and you're not really getting the full benefit of the medication. So it's really, really important to ask your doctor or your pharmacist to show you how to use your inhalers, especially if it's a new inhaler. And I would actually recommend that you have your doctor or pharmacist watch you use your inhaler and give you feedback on your technique. It's very common for people to think that they're using their inhaler device correctly, but when I actually watch them, there's usually a pointer or two that I can give them to improve their technique. Next. Thankfully, there's a lot of resources online to teach people how to use their inhalers correctly. The Respiratory Health Association has really nice documents in their library online. And the image on the left is an example of one of the documents to show or to demonstrate the correct technique for a particular type of inhaler. I listed the webpage for that library below that picture to the left, and I would encourage you to check out some of those documents and review them at your convenience. Another website that I really like is use-inhalers.com. If you have a smartphone or a camera, you can hover over that QR code and it'll take you to the website. I like useinhalers.com because it has both written instructions and videos to demonstrate correct inhaler techniques. So if you're a visual person like me, those videos can be really helpful. And again, I really want to emphasize that I would encourage you to actually have your doctor or pharmacist watch you use your inhaler and give you feedback on your technique, because it's very, very common for someone to think that they're using their inhaler correctly. But when we watch them, we find that maybe there's a step or two that could use a little bit of improvement. And I do this routinely in my clinic. So I would encourage you guys to do the same. Next. After being prescribed inhalers for COPD, that really shouldn't be the end of things. It's really important for you to regularly review how things are going with your medication with either your doctor or your pharmacist. Some of the questions that you should be asking yourself are, do I feel better since starting my new medication? Have I been in the doctor's office or emergency room or hospital less since starting my new medication? Do I ever miss doses of my medication? Can I afford it? Am I using the inhaler device correctly? If you find yourself missing doses of your inhalers or you answer no to any of the other questions, your doctor or pharmacist should consider adjusting your medication regimen or providing some education or training to ensure that you're getting the most benefit out of your medicines. Next. While inhalers are the cornerstone of COPD treatment, there are 2 oral or pill medications that can be used to treat COPD as well. Those medications are called roflumilast and azithromycin. Unlike inhaled medications, these are reserved for just a select group of patients with COPD who have frequent flare-ups or exacerbations. These medications are proven to reduce the frequency of those exacerbations or flare-ups. But it's important to note that they do not improve symptoms. Therefore, the benefit and the use is really only reserved for patients who have frequent flare-ups because the medication is meant to reduce the frequency of those flare-ups. Most people with COPD will not need to use those medications, so it's really important to talk to your doctor to determine if you would benefit from taking either of those medicines. Side effects are pretty common with those medicines, and they occur more frequently compared to inhaler medications. So the potential side effects are also an important thing to bring up with your doctor before starting either of those medications, because the concern for side effect may make one of them not a good option for you and the other one a good option for you. Next. I'm happy to say 2023 is a really exciting year for COPD treatment because there's 2 new drugs on the horizon that have shown promising results in clinical trials that were published this year. These medications, called dupilumab and ensifentrine, actually work differently than any of the current COPD treatments that are available. So the treatment options for COPD may be expanding very soon. However, both of these medications are currently under FDA review for approval to treat COPD. So they're not available yet. However, there's a good chance that they'll get approved and they might be available next year. So be sure to follow up with your doctor and ask about them and whether they're available and if you would benefit from using either of those medicines. Next. So moving on to oxygen therapy for COPD. It's very common for someone with COPD to need oxygen when they get sick, particularly if they're hospitalized for a COPD exacerbation or they have another acute respiratory illness such as pneumonia. The good news is that for many, they only need short-term oxygen for a few weeks or a month or two as they recover from their acute illness. So if you're ever prescribed oxygen in the future, please know that it does not mean that you need to oxygen forever. It's recommended that you have your oxygen levels rechecked within a month or sometimes even a second or a third time to determine if you need long-term oxygen or if oxygen can be discontinued because your oxygen levels have returned to normal. It's very important to follow the instructions for how much oxygen to use and when. For example, we'll often prescribe oxygen in one amount or setting to be used at rest and another amount or setting to be used with physical activity. For example, 2 liters per minute at rest and 4 liters per minute with exertion. It may be harmful to use more oxygen than you need, so it's very important to follow the directions and the time that the oxygen is prescribed. Another safety aspect that's important to review is that you should not smoke around oxygen or use an open flame, such as a gas stove around oxygen, because it could lead to a dangerous fire. Next. Some people with COPD need to use oxygen long-term. We call that long-term oxygen therapy, or LTOT, when their oxygen levels never recover once they're stabilized from that acute illness. For patients with COPD who have severely low oxygen levels at rest, meaning that when they're sitting or they're standing, their oxygen is severely low, using long-term oxygen for at least 15 hours a day can help them live longer. However, for patients who have recovered from their illness and their oxygen remains moderately low at rest, or their oxygen drops when they're physically active or walking around, studies actually do not show any benefit to using oxygen in terms of survival, symptom, or quality of life. Now, I have many patients who are prescribed oxygen but no longer have severely low oxygen levels at rest. But they tell me, Dr. Lebeds, I feel so much better when I use oxygen. I feel like I can breathe more and I can go farther. And so if you ever find yourself in that scenario, it's important to discuss your situation with your doctor and come to a shared decision about whether or not to continue oxygen. If your doctor does determine that long-term oxygen is beneficial for you, it's important to note that your oxygen prescription, or how much oxygen you should be using, is almost certainly going to change over time. Therefore, how much oxygen you need today may be very different from how much oxygen you need in a few months. So be sure to have your oxygen levels regularly checked and have your oxygen level or your oxygen prescription adjusted as needed. Using oxygen definitely adds a layer of complication to people's lives, and so they really need to plan ahead, especially when they travel outside of their home, to make sure that they have the right equipment, in particular if they're traveling long distances by car or plane. Things that they need to consider are how long their oxygen supply will last, if they have enough battery life on their device, and if they're traveling by plane, they will need to have a portable oxygen concentrator because pressurized oxygen tanks are not allowed on planes. I have a QR code at the bottom right of the slide that will take you to the Respiratory Health Association's oxygen therapy and travel document. That's a really nice reference for how to plan ahead if you're traveling with oxygen. Next. There are many different types of oxygen equipment that are used to deliver oxygen. All patients who are using oxygen should be prescribed a portable delivery system that they can bring with them if they leave the house, and a larger, more powerful stationary system that stays at home. Most of the time, people will first be given oxygen tanks to use when they leave the house, but these tanks are made of metal, they're really large, they're quite heavy, so they can be pretty burdensome for people to carry around. There are smaller, more portable oxygen concentrators that can be carried around like a purse. But unfortunately, they're not always covered by insurance, and many people need to pay for the cost of that machine out of pocket. In rare circumstances, when a person requires a very high level of oxygen, they'll be prescribed a special liquid oxygen system or a high flow oxygen system. So if you're someone who's using oxygen and you feel like your equipment isn't working for you, I would encourage you to talk to your doctor about alternative oxygen equipment that may better suit your needs and your lifestyle. Next. Lastly, I'm going to review some of the surgical or procedural options for treating COPD. I only have one slide on this topic, and I'm not going to spend as much time discussing it because there's only a very narrow, selective group of patients with COPD who are candidates for these treatments. The surgical treatment that has the best data to support its use in COPD is called lung volume reduction surgery. And in this surgery, areas of severe emphysema, where there's hole in the lungs, are surgically removed to improve breathing mechanics and gas exchange. This surgery does come with considerable risk, and only a highly selective group of patients benefit from this surgery in terms of improved exercise capacity and improved mortality. In fact, some patients outside of this very selective group may have increased risk of mortality with the surgery. So it's very rare that somebody will be considered for lung volume reduction surgery. It's something that should be discussed with your doctor if it's an option for you. Similar to the surgical lung volume reduction, there is bronchoscopic lung volume reduction that is achieved through a procedure called a bronchoscopy. Similarly, a highly selective group of patients with COPD benefit from this procedure, and the benefits include improved lung function and improved exercise capacity. There are fairly high complication rates from this procedure, about 1 in 4. So the decision to pursue this treatment is not taken lightly. It's not a bad idea to ask your doctor about surgical or bronchoscopic lung volume reduction to see if it might be an option for you, but just know that the chances are more likely than not that these procedures would not be beneficial for you. Finally, lung transplantation is a surgical option for treating those who have very advanced and progressive COPD despite maximum medical therapy, and for those who are not candidates for lung volume reduction surgery. Evaluation for lung transplantation should be undertaken at a center that specializes in lung transplants to determine if somebody is a good candidate. And that evaluation is very extensive and usually requires many tests to determine if somebody is a candidate. Similar to the other surgical options, lung transplantation does come with considerable risk, and people who receive lung transplantation require medication to suppress their immune system to prevent organ rejection. So it puts them at risk for infections for the rest of their life. So it's not a decision that's made lightly, and it's very involved, requiring a lot of testing. However, for those who do receive lung transplants, it can be life-changing, and for some people, it can help them live longer. Next. So here's a list of helpful resources. If you're interested, I recommend just taking a screenshot or a picture with your phone. These are resources that are provided online and are aimed at educating patients. So they're written in language that anyone can understand. They address things like medications, COPD action plan, quitting smoking. So I would encourage you guys, if you're interested in more information, to visit these web pages because there's lots of good information online. It's just sometimes difficult to know where to find the good information, but these are really good resources that both Lori and I recommend visiting. Next. So thank you guys if you made it through the end of this talk. Real quick, just to review some of the key takeaway points. Very important to get your flu vaccine every year. There are medications available to help with cravings and to help you quit smoking. So be sure to explore all available options for you because quitting smoking is the single best thing you could do for your COPD if you're still smoking. Inhaled medications are recommended for all patients with COPD, and treatment should be personalized for you and modified as needed. The other treatment options, including oral medications, oxygen, bronchoscopic, and surgical treatments for COPD, should be considered in select patients, and I would encourage you to talk to your doctor about whether those are options for you. And then finally, let your doctor and pharmacist know if your goals for treating COPD are not being met with your current COPD medications. There may be other options for you, and there may be new options that are coming soon. Thank you again for taking the time to attend our talk. We're happy to open up to the audience any questions that you have for either myself or Dr. Lori Wilkin.
Thank you so much. Thank you so much. We will ask some questions, and then if you guys have any other questions, just put them in the chat or the Q&A box. One that we had was the cost of inhalers is out of this world. Has RHA, oh, that's an RHA question. Here, we have another one. Are COPD patients prone to pulmonary embolisms?
As far as I'm aware, that is actually not a risk factor for developing pulmonary embolisms. That's a great question, though.
What are the benefits of a nebulizer versus an inhaler?
Interestingly, and Lori can help me with this question, nebulizers have not really been shown to be any better than inhaled medications. They're both effective. However, in the setting of acute COPD exacerbations or flare-ups, nebulizers are typically preferred because patients tend to feel like they help them better and they deliver the medications maybe a little bit more effectively in that setting. But for those who have stable COPD, there really aren't any benefits to using one type over the other. That being said, the number of medications that are available for a nebulizer device are substantially lower in number than those that are available in inhaler devices. In addition to that, inhaler devices are smaller. They can fit in your hand, your pocket, so they're much more easier to take around and carry with you. So nebulizer machines, because they have to be plugged into a source of electricity and they're bigger and heavier, they're just not as portable. So for that reason, or those reasons, I typically prefer to prescribe inhalers. However, nebulizers are just as good. They're very effective. It's just that the options in terms of the different drugs that are available for a nebulizer device are pretty limited. And there's the issue of needing to have your nebulizer machine available with you.
One question that we received was, do you ever get off of oxygen after starting?
Absolutely. Absolutely. Yes. So I would say almost universally when somebody is started on oxygen, it's in the setting of them being hospitalized for an acute respiratory illness, whether that's a COPD exacerbation or an infection like a pneumonia or some other condition that affects their breathing. I don't have numbers, but I would say many, maybe even most people who get started on oxygen in the hospital do not need oxygen long-term. However, we don't always do a good job of explaining that to patients when they get started on oxygen. Oftentimes when they get in the hospital, we say, here, you need this oxygen, this is how you're supposed to use it, go home. And we don't explain to patients that this is probably going to be temporary. So many people, when they get prescribed oxygen, they're under the impression that this is something I have to use forever. So when I see those people, when they follow up with me or I see them in the hospital, I do try to tell them that this is not something that is going to be something you need to take forever. It might be, but it might not be. What we really need to do is have you follow up closely with us, within a month and recheck your oxygen levels. We may find that you need less oxygen when you see me, or you may not need oxygen at all anymore. But there are some people who will need oxygen long-term, but the only way to determine that is to follow up with your doctor or a nurse to have your oxygen levels checked within weeks or a month after you get prescribed oxygen.
Great. Another one we have is, what is the current mortality rate after a lung transplant?
That's a really good question. I don't have an answer for that, and I apologize. What we do know in terms of lung transplantation is not necessarily mortality rate, but maybe like survival over time. And that will really depend on a number of like individualized patient factors. The patients that are selected for lung transplantation are those who we expect will have good outcomes and are not high risk for mortality. But in terms of survival from lung transplant, I believe that at 5 years, the survival is around 50%. But don't quote me on that number. I'd have to look it up. Oftentimes, patients who are referred for lung transplant are expected to have a worse survival at 2 years or 5 years. So even though the survival rates at 5 years are not great, the idea when you refer someone for a lung transplant is that their expected survival without the lung transplant is probably worse than their survival with the lung transplant, which is why we make the decision to refer them for that.
Great. What are your thoughts about injectable medications?
That's a great question. So currently there are no FDA approved injectable medications for COPD. However, the medication dupilumab that I referred to on the slide about upcoming medications is an injectable medication that has shown very promising results for COPD. It is currently FDA approved for patients with asthma who have a specific type of inflammation that drives their asthma. So it's currently on the market for other conditions, and not only just asthma, but I believe eczema is another indication for it. So it's already on the market. It's widely used. It's just not approved for COPD. So I think it's very likely you're going to see that medication approved and starting to be prescribed probably next year. It's just not available yet. I also imagine that pharmaceutical companies are developing injectable medications as we speak, and there are going to be more of that arrive on the market in the future. We just don't have any options at this time.
Right. Is it important to take my inhalers every day, even on days when I feel good, and why?
Yes, particularly if it's your controller inhaler. The controller inhaler is intended to be used every single day, regardless if you have symptoms. Now, I have patients who tell me, well, if I don't have symptoms, why should I use it? And I tell them that if you use it, it probably is going to prevent you from having symptoms tomorrow or the next day. In addition to that, we know that those controller inhalers not only improve symptoms, but there are other benefits to using them, such as reducing the number of flare-ups from COPD that you're going to get and reducing the risk or the likelihood that you're hospitalized for COPD. So even if you feel like you're not having symptoms and you don't feel like you need to use it for that reason, you're still getting other benefits from using it. And just because you don't have symptoms today or at that moment, using that medication regularly will reduce your overall symptom burden from day to day. So if you don't have symptoms today, using that controller inhaler today may lower your symptoms tomorrow or the next day.
Great. I'll ask one last question. From a doctor's perspective or a health professional's perspective, how can I make the most out of an office visit?
That's a really good question. And I think a difficult one for me to answer because it really depends on what your goals are and also what your doctor's goals are. Because I often have things in mind that I want to discuss with my patients, and they come in and they have a totally different sort of objective than I do. I would say if we were to go back to that slide from earlier in the discussion of things to think about when you're considering your medications, yes, review your medications. These are things that I would recommend sort of thinking about and things to bring up with your medication. So how are your symptoms? How are you feeling? Have you had any flare-ups of your COPD that required you to go to see your doctor or the emergency room or be hospitalized? Are you missing doses of your medication for any reason at all? Is your medication affordable and are you using it correctly? I think these are things that should be reviewed at every single visit. But there's also going to be additional things that are very personal to you that you may want to bring up. But if I were to answer your question, generally speaking, these are things that I would recommend bringing up to make the most of your visit and making sure that the treatment that you're on is the right treatment for you.
All right. Thank you so much for your wonderful presentation, Dr. Wilkin and Dr. Lebeds. We really appreciate you coming to talk with us today. That was our last presentation of the day, so thank you all for sticking around for it. And we would like to invite back our CEO, Joel Afric, to wrap up today's Living Better Together conference.
Thanks very much, Cherna, and to all of our speakers. Thank you all for spending World COPD Day with us. As we wrap up the virtual event, we want to thank Dr. Hansel, Dr. Manassian, Dr. Lebeds, and Dr. Wilkin for donating their time for this event and sharing their various experiences with us. Here at RHA, our activities are guided by an advisory committee that helps inform our COPD programming activities. I want to thank advisory committee members Ari Jaffe and Cindy Gronkowitz for their guidance in connection with today's programs. Thank you again to our sponsors, AstraZeneca and Verona Pharma, for their support with our COPD programming. And finally, we'd like to thank all of the pulmonary rehab partners that were with us today: Ascension's Illinois Suburban Lung, Advocate Good Shepherd Hospital, Northwest Community Hospital Edward Elmhurst, and Northwestern Palos Hospital for live streaming today's event and helping to share this educational experience with their patients. And finally, I'd like to thank our staff members at RHA, Rachel Morkunis and Cherna Halpern, our lead staff today, and all of our staff from RHA's Programs and Policy Department, Development Department, and Marketing and Communications teams who helped to make today a great success. Thank you all.
Okay, we hope you found today's program educational, and we would love to see you again next year. Here's our a slide with all of our contact information if you have any questions or want additional information post-conference. As a reminder, we will be sending out a post-conference recap email with all of the resources discussed during today's events and the links to the recorded webinar. We hope you have a happy and healthy holiday season and new year. Thanks again for joining us.